Good evening, everyone, and thank you for joining us for the first virtual hearing of the 2020 Platform Drafting Committee. I'm Keisha Lance Bottoms, and I have the great honor of serving as the 60th Mayor of Atlanta, the birthplace of the Civil Rights Movement. It's truly an honor to chair this committee as we all work together to build a better America. Repairing the damage that Donald Trump has done to this country will be the work of generations, but it begins with electing Joe Biden this fall and implementing what will be, without a doubt, the most progressive platform in our party's history. Progress is rarely easy, but together, I believe we can move our country forward and resign Donald Trump to the dustbin of history and elect Joe Biden president. Thank you to everyone on this committee for your commitment to our party and our country's future. I look forward to the work ahead of us. Now, if you will please join me in the Pledge of Allegiance, and if you can unmute yourself so that we can all recite it together, that would be. I pledge
allegiance to the flag
of the United
States of America
and to the
and to the
republic
republic
for which
which stands
one
nation under God,
indivisible,
indivisible,
with
with liberty and justice for all.
Thank you. I'd like to acknowledge DNC Chairman Tom Perez. Tom took the helm of the DNC after the 2016 election and has worked tirelessly to rebuild our party. Under his leadership, the DNC has repaired the party's infrastructure and invested in candidates all across the country and at every single level. Rebuilding the party from the ground up and ensuring that all voices have a place in our party will be some of the key elements of our success in November. Please join me in welcoming DNC Chair Tom Perez.
Thank you, Mayor, for your kind words, and thank you everybody on this drafting committee for your service, and thank you to everybody watching today for your participation. It is so critically important that every voice be heard, and this is indeed the first convening of the Democratic Party's Platform Drafting Committee. Mayor, thank you for your service. As people know, the chair of the drafting committee 4 years ago was a hero to all of us, the late, great Elijah Cummings. And Chairman Cummings served with great distinction, and as a proud Marylander, I so miss him, and we so appreciate his service. We are so confident under your leadership that we will move forward in a remarkable way. And I want to thank everybody on behalf of the Vice President as well. He's so appreciative of both your service and your input. Now, unlike our Republican counterparts, we don't cut and paste our platforms from years past. That might actually explain why the Republican Party's policies feel so backward. They keep reusing those outdated views. Democrats are indeed looking forward, and we're putting together, as the mayor correctly said, the boldest platform in our party's history, a platform that will indeed meet the moment, because this truly is a challenging time, from our global pandemic to the devastating economic recession, some might call depression, caused by Donald Trump's chronic incompetence, to the unrest that has gripped our nation as a result of police violence against African Americans. We are truly at an inflection point in our journey to form a more perfect union, and the American people are hungry for Democratic leadership in the White House and up and down the ballot. In the words of the Vice President, we are indeed in a fight for the soul of our nation. Every single day shows how stark of a choice America is facing. On one hand, we have Donald Trump, a man of chaos and cruelty. On the other hand, we have Joe Biden, a man of courage and compassion, empathy and integrity, and accomplishment. A dreamer and a doer. Somebody who gets things done. Somebody who understands that idealism and pragmatism are not mutually exclusive. But this election is more than simply about Joe Biden and Donald Trump. It's about two competing visions for America. 5 years ago, when Donald Trump announced his campaign for president, he promised and unfortunately delivered on a very dark vision for our country. But in this November, we will begin a new era, an era of justice, and equality, and inclusion, an era of economic prosperity and opportunity for all, an era of bold American leadership, where our nation's strength is not defined by the size of our tanks or the thumping of our chests, but by the compassion and dignity we show each other and the world. Those are the American people's values. Those are the Democratic Party's values. Those are Biden's values. And I am confident that those values will be reflected up and down in our platform. I'm so proud of the committee that we've put together. Crafting our party platform is critical work, especially at this moment. And I know the members of this drafting committee will engage people in a substantive dialogue of ideas and solutions that will articulate our party's vision for the country and mobilize voters in every community to elect Joe Biden and his historic running mate. Democrats are fighting to build a better future for all, and the American people know that we are the party, in fact, the only party that has their backs. Now, again, I want to turn it back to Mayor Bottoms. Again, thank you so much, Mayor, for leading this. You have a lot going on, but you recognize the importance of the task, and I can't think of somebody better suited at the moment to, in fact, meet the moment. So thank you so much for your service, and I will turn it back to you.
Thank you, Mr. Chair. We appreciate you so much. And before we get started, I'd like to introduce the drafting committee members. This is a remarkable group of people who are leaders in the forefront of their fields, and their expertise will be an invaluable resource during this process. First is Dr. Tony Allen. He is the president of Delaware State University, one of our great HBCUs. Stuart Applebaum is the president of the Retail, Wholesale, and Department Store Union, hails from New York. Congresswoman Catherine Clark of Massachusetts represents the 5th Congressional District in Massachusetts. And Senator Tammy Duckworth of Illinois serves as the junior senator from the state of Illinois. Congresswoman Sylvia Garcia of Texas represents the 29th Congressional District in Texas. Dr. Heather Gottney of New York is an associate professor at Fordham University. John Graves of Ohio is the former Domestic and Economic Policy Director in the Office of Vice President Biden. Congresswoman Deb Haaland of New Mexico represents the 1st Congressional District in New Mexico. Ana Lily Mejia, I hope I got that right, of New Jersey served as the political director on the Bernie Sanders 2020 campaign. John Orton of Wisconsin serves as a senior advisor to Senator Sanders. State Senator Jose Javier Rodriguez of Florida is a member of the Florida Senate representing the 37th District. Julianne Smith of DC serves as the senior advisor to the president at the German Marshall Fund. Richard Trumka of Pennsylvania is the president of the AFL-CIO, and Tom Vilsack of Iowa is the former Secretary of Agriculture under President Obama. In addition, we also have Congresswoman Barbara Lee, who will serve as an ex officio member and was a member of the 2016 Drafting Committee. Carmel Martin serves as senior advisor for policy on the Biden for President campaign, and is the campaign's non-voting representative on our committee. And last but not least, I would like to introduce you to the team who will be working with us throughout this process. Andrew Grossman is the platform director. He also served as a platform director in 2012 and 2016. Leah Moody is the deputy director and has over 2 decades of experience working with allied groups and elected officials. Patrice Taylor is the director of party affairs at the DNC and is responsible for all of the party business that happens at the convention. Christina Costa and Mayton Shorev are the writers and will be working with each of you as they put together the proposed draft that we will review. Zephyr Krager is from the Biden campaign and serves as a liaison between the campaign, convention, and party. And Quinn Tran and Tabitha Schustock round out the platform team. Quinn was also part of the platform team in 2016 and 2012. And now let's get started. So my apologies if I mispronounce any names. There is a certain way that Southerners put our own twang onto everything. So my apologies if I didn't pronounce those correctly. Today, we are holding the first of 3 virtual hearings where we will hear from individuals who will share their personal experiences, thoughts, and ideas on what should be reflected in the platform that will govern our party for the next 4 years. Just today, the DNC announced our digital engagement to invite Democrats to share their input through stories.demconvention.com. On this site, voters will be able to provide comments and even upload a video where they will tell us what they would like to see reflected in the platform. So in addition to what we will learn during these hearings, we will also be informed by the comments we receive online. Our first session, Addressing the COVID-19 Health Crisis and Building Back Better, is a theme that speaks directly to what all Americans are currently navigating during the coronavirus outbreak. The failed response to this pandemic by the Trump administration was preventable and will have a lasting impact on so many. Joe Biden and Democrats believe that the American people deserve an urgent, robust, and professional response to the growing public health and economic crisis caused by the COVID-19 health crisis. Today, we will hear from 18 speakers who will share their input on the best health and economic response and strategies needed to address this ongoing global crisis. We will now hear from our witness, Rebecca Katz, Professor and Director of the Center for Global Health Science and Security at Georgetown University. Welcome, Professor Katz.
Thank you so much for the opportunity to be here today. And I was asked to provide an overview of the current situation. And as you're all aware, the COVID-19 virus emerged in late 2019 and quickly grew into a global pandemic. In a few short months, we've seen more than 10 million cases around the world and 500,000 deaths. In the United States alone, there are now more than 2.5 million documented cases and over 126,000 deaths. And to put this into perspective, while we account for only 4% of the global population, we have 25% of all cases and deaths. While states are having very different experiences with the virus, it is clear that the majority of the country, at least 30 states, are now seeing increased cases, some with exponential growth. Minority communities with greater burdens of comorbidities, more exposure to the virus, and less access to care are being hospitalized and dying of the virus at higher rates than the rest of the population. Much of the South and Southwest are now seeing higher numbers of total cases, particularly among younger populations. Hospitals in Houston, Phoenix, across Mississippi are stressed. Over 60% of the population, more than 200 million people, are currently in the middle of virus hotspots, and approximately 95% of the population remains vulnerable to the disease. Yet, the American public is tired, and many political leaders have rushed to reopen the economy without the infrastructure necessary to control the virus. So many states have refrained from imposing aggressive restrictions, opened up parts of their society early, and have been lax in enforcing public health measures. In the face of rising numbers, there are thankfully additional measures being put into place for mask wearing, and some of the most heavily affected states have put a pause on reopening non-essential places of businesses. But the response continues to be uneven across the country. In the absence of an effective medical countermeasure, which we don't expect until possibly mid-2021, this pandemic could go one of two ways. It could get worse or it could get better. But we know it works, and we've seen it work in other countries. We've seen it work in jurisdictions within the United States, including states initially hard hit by the virus, like New York. We know that strict physical distancing to break the cycle. personal behavior to include facial covering, physical distancing, hand hygiene, staying at home when ill, a compliance plan for ensuring this happens, and effective public health measures to include testing, tracing, tracking, isolation, quarantine, managing an integrated data architecture that's transparent and informs decision-making. If these measures are not taken, the virus will continue to spread through our population, killing our most vulnerable, destroying our economy, crippling educational advancement of children, and creating chains of second-order impacts we can only begin to imagine. Or we do the work and control the virus. We can come together as a society, as a community, and protect each other. We work with partner countries to collectively address this global threat. The list of things we could and should do is long, and I've included them in my written testimony, but here let me just say this. The COVID-19 pandemic continues to be an evolving situation, and we will be forced to make decisions under uncertainty, but there is a path forward that we can follow and save lives.
Thank you, Professor Katz. And to get us started, I will recognize Representative Clark with a question.
Thank you. It is good to be with you. I wondered if you could tell me how we can make the World Health Organization more effective.
I really appreciate the question. I think first we need to be actively engaged with the World Health Organization. As you all are aware, the Trump administration has indicated its intent to withdraw from the organization, whether it's possible or not. But we're not currently engaged at the level that we need to in the middle of a global pandemic. I think so one, there's engagement. Two, there's participating and being part of the global conversations that are happening around therapeutics and vaccine development, and how we will ethically distribute a vaccine once we have it. But I think one of the main challenges of making sure that the organization is effective is actually fully funding it. It has been operating at a minuscule budget, yet we, as a global community, have asked much of the organization. So one of the challenges is actually making sure that we strengthen this organization before we talk about going different ways, and give them the opportunity to do the job we want them to do.
Thank you.
All right, thank you very much. I'd now like to recognize Representative Lee with a question.
Thank you very much, Mayor Bottoms, and thank you so much, Dr. Katz, for your testimony. Let me just ask you with regard to the federal government. We've seen many failures, and we've also seen some state and local successes, but it's our federal system that are the ones tasked for implementing our public health measures. What do you think the federal government can do much better in terms of equipment, state and local governments to continue the fight against COVID and to prepare for the next pandemic? Also, you mentioned minority communities being heavily impacted and disproportionately impacted. How does this administration address the racial and ethnic disparities? And what do you think we need to do to address them? Because, as you know, Black and brown people are dying disproportionately. We need to do something now. And what do you suggest we do? Thank you again.
Congresswoman, I couldn't agree more. Now, they're going to kick me off of this platform in about a minute, so I'm not sure I can do justice to any of your questions, but I think that there is so much that the federal government could and should be doing. Public health is a governmental function, and the Trump administration basically abdicated its responsibility in responding to this pandemic. I think that we, and to their credit, governors and mayors across the country have stepped up in ways that we've never prepared them to do before, because there was always the assumption that the federal government would do all the preparedness and the planning and have the resources. I think a couple of very quick points. So as I mentioned, I've got a ridiculously long laundry list of things that we could and should be doing. But at the very minimum, communication. There has to be daily evidence-based communication to the public. There needs to be data that is trusted and transparent in guiding decision-making. We need an effective workforce for response, for contact tracing, requiring an army of public health workers. We actually need to fund public health in ways that we haven't done in the last couple of decades. We need supply chain. We have to address the challenges, ensure we have sufficient personal protective equipment, medical supplies, medical countermeasures, and this is going to require major investments in national manufacturing capacity. We need to promote scientific advancements so we can get a rapid point-of-care diagnostic, antiviral treatments, safe and effective vaccines, solutions to this pandemic. I think we need unified guidance and action, and that's something that we haven't seen coming out of the administration. Operational guidance for response, for travel enforcement, and we need to have a federal government that is embracing global partnerships. Now, all of this doesn't even get at the incredibly important challenges that you're raising that get to the core of access to care. The core, what are the socioeconomic challenges that are impacting the disparities in health, and ensuring that people can actually get sick leave. I mean, the layers of challenges that we have to address to improve public health in this country are numerous, and it's going to take a massive effort.
Thank you very much.
Thank you very much, Professor Katz. We will now hear from Johanna Puno-Hester. Johanna is the Assistant Executive Director of United Domestic Workers of America, AFSCME Local 3930.
Thank you. That's great. You got it right, Mayor. Good afternoon, committee members, and thank you for the opportunity to speak today as a voice for home care and child care providers. We represent over 115,000 home care providers and 15,000 family child care providers across California. The members of UDW care for children, seniors, and people with disabilities in the home. COVID makes these crucial jobs even more necessary and even more challenging for the workers who do them. I want to say this to the committee. Without care work, no other work is possible. Just about every American worker relies on someone to help care for a child or family member. And without care work, we will not be able to keep our families safe at home from COVID and future pandemics. As we know, the majority of those who have died are seniors, and most have died in nursing homes. Home care keeps seniors out of these costly institutions in the first place. Home care workers allow seniors to age at home with dignity, and they make it possible for people with disabilities to live independently in the community. Without home care, many, if not all of these people would end up in a nursing home. For these life-saving work of feeding, dressing, bathing, and caring for the needs of our most vulnerable, home care providers earn on average $13.75 an hour, and over 90% relying on publicly funded healthcare coverage. As of today, we have more than 80 members who have tested positive for COVID, and 2 in Imperial County who have died that we know of. Conditions are challenging for home care and child care workers who have lacked basic access to PPE, disinfectant, and other supplies, and yet had to keep working. Many child care providers who run daycare out of their own homes had to close shop because they are either over 65, pregnant, or are immunocompromised. Some home care workers were turned away from families who feared COVID, and others acquired COVID at work and brought the virus home to their families. How will we meet the needs of children, seniors, and people living with disabilities now and in the future? We must dignify this profession and the lives of caregivers who in California are majority women of color and majority immigrants. The women who do this vital work do not have the privilege to telecommute. They face economic instability and continue to experience longstanding racism and inequity. We must do better, and that starts with standing in solidarity with Black Lives Matter, closing the wage gap by unionizing the workforce, and investing in the programs that serve children, seniors, and people living with disabilities. urge you to make care work and the wages and conditions of care workers a key component of your discussion here today. Ending COVID will require this. Thank you. You have our support in your effort to address the major issues facing women, people of color, and all workers in the economy today.
Thank you very much. To get us started, I will recognize Mr. Orton, who has a question.
Thanks, Joanna. Thanks for your selfless work of you and your colleagues and for contributing your voice today. And I just wanted to acknowledge that since Trump took office, we've seen a constant attack on home care workers, and your job has become radically harder and more dangerous during the pandemic. So let me ask two dimensions to the same question. First, can you talk a little bit about how the job of home care workers has changed since during the pandemic in terms of how you do your work, the added responsibility, and what you're not getting? And then second, I'm hoping you can just tell us a little bit about how the COVID pandemic has affected your life overall, the anxiety you feel, the concern, the stress you're under. Just if you can talk a little bit about the human side as well.
Absolutely. I appreciate that opportunity to just speak on that. I think many home care workers, along with child care providers, also have fears of getting COVID themselves and passing it on to their families. So the stress of that in and of itself, because California closed, many of the programs that seniors and people living with disabilities, the programs that they participate in have closed. Home care providers sort of have served in the capacity of working to fulfill that void. And so that's really critical at this point in the lives of home care providers. Home care providers provide care for their family members. And so, that's been a real, a good thing, being that they're staying with their families, but many don't have that luxury. And so if we don't care for the clients, then they just don't receive the care.
Thank you.
Thank you. And President Applebaum has a question.
Thank you, Mayor Bottoms, and thank you, Johanna, for your testimony and for your work. Working in isolation, caring for other people's loved ones, the issues faced by home care workers during the pandemic have mostly been invisible. I'd like to know what more should be done to address the health and safety concerns of home care workers, and specifically, I'd like to note that PPE has been prioritized for healthcare workers in hospitals and nursing homes, often to the detriment of home care workers. What has the shortage of PPE meant for home care workers?
Thank you for that question, Mr. Applebaum. Home care providers have been, from the very beginning, have acted to protect themselves and their clients. Many have created makeshift protections themselves prior to receiving PPEs from the counties. We have a wonderful governor in California, Governor Gavin Newsom, who works very closely with our union to help assist us in making sure that we're getting PPEs. But as you know, that's just simply not enough. The amount of times that providers need to change PPEs to do the work for their clients are numerous in a day. And so that's really critical.
Thank you.
Thank you so much, Johanna, for your testimony, your leadership, and the very important work that you do. We greatly appreciate you. Next, we will hear from Danielle Atkinson, the founder and executive director of Mothering Justice.
Hello, everyone. Thank you so much. My name is Danielle Atkins, and I'm founding director of an organization for mothers of color called Mothering Justice. The last few months have been trying, to say the least. In March, our lives have changed in the blink of an eye. Without warning, we lost our jobs, our caregivers, and for so many of us, we lost the ones we love the most. This virus took our security and our safety and exposed to many of us what most of us already knew. Our country was unprepared for this disaster. Years of deprioritizing the well-being of our workers left us flat-footed when we needed to respond. For parents already living on the margins, paycheck to paycheck, support came late, well after pink slips and well after rent was already due. For the ones on the front line who keep us safe in our homes, they were left without care for their children when it was their time to work. The relief passed by Congress left confusion and overloaded the system because we never built the infrastructure to handle the demand. And yes, the demand was unprecedented, but the signs that we needed a stronger system have been present for a long time. We needed to be prepared for mass unemployment, for the loss of access to healthcare, and for workers that needed to stay home. We need a bigger net. The percentage of families concerned with not getting enough to eat has doubled in this pandemic, despite the one-time federal stimulus payments and the temporary boost to unemployment benefits, because the ground was already falling from underneath them. We also need to add 2 additional critical pieces of conversation when it comes to safety net. The first being paid leave. Our own health depends on the person next to us and the person next to them. We must ensure that everyone has access to paid leave to keep our community healthy. When people have to make the choice between paying their bills and staying home to get well, they're going to go to work sick. It's an impossible decision that leaves our communities in jeopardy. We need to make paid leave for all a priority if we're going to open our country and ensure the financial stability of each worker. The second issue that gets left out of the conversation when it comes to safety net is their childcare system. Our childcare system was among the hardest hit by the COVID-19 shutdown. A third of childcare workers nationwide were laid off or furloughed. And because the childcare providers operate on such a thin margin, many will close their doors forever. Without childcare, many children won't get the early learning and that leads to the critical brain development and school readiness that they need. The childcare industry needs significant federal funding to be able to be there for the families when it's time to return. Simply put, our community doesn't work without childcare. These issues are far too often deemed side issues, but they are human issues. And if we are to weather this storm and the next one, we have to put the needs of the people hardest hit by this crisis in front.
Thank you, Danielle. And to get us started, we will go back to President Applebaum for our first question.
Thank you, Danielle. It's good to be with you, even if it's virtually. You spoke about paid leave. I'd like to ask if you could talk about what paid family leave and paid sick leave would mean to the communities you work with.
Yes, paid leave is close to my heart. It's really what put me in this fight when I was a worker who didn't have paid leave and I was pregnant with my first daughter. Paid leave means the ability to be equal, the ability to close the wage gap, the ability to be there with your child when they're sick, when they're going through surgery, to be there when your family member is dying or you're welcoming a new child into your home. It is not only a moral issue, it is an issue of financial stability for our country.
Great. Thank you.
Thank you.
Thank you very much, Danielle. And now I'd like to recognize Anna Lilly.
Thank you, Mayor. Danielle, so congrats on your efforts on getting earned sick days and pushing for earned sick days across the country and in Michigan. It's also near and dear to my heart. Can you speak a little bit about, under the current pandemic and the reality that workers and working parents are toiling under? Can you speak a little bit about the stress that homeschooling is having on working families, on particularly the already vulnerable working mothers and communities? And if you could also touch on the concerns that homeschooling is threatening working mothers in terms of pushing them out of the workforce or exacerbating stress and disparities, given technology isn't equitably distributed in all of our communities.
Exactly. It is an issue of equality when we're talking about the ability to go to school. One of the fundamental principles of this party and this way of thinking is equity. And public schooling is so important that our children are able to learn beside their classmates, whether they are from their same community and really embody a mirror, or they're from a different community and embody a window and an opportunity to see another way of being. We have to ensure that we can do that. It is imperative. I know my children can definitely speak to the stress of their mother who's not a trained teacher giving them instruction, but also on a more serious note, we are facing a crisis when it comes to women predominantly, but parents in general, their ability to compete, be in the workforce, or even just earn a living if they are not able to work.
Thank you so much, Danielle. And my apologies, Anna Lilia. I'm going to get it right. Thank you. All right, and please join me in welcoming Ron Busby. Ron is the president and CEO of the U.S. Black Chambers, Inc. Thank you for joining us.
Thank you, Mayor. As a FAMU alum, it's great to see you as well. And to the rest of the committee, appreciate you having me on to speak on behalf of the U.S. Black Chambers. We represent 145 chambers in 42 states and have a membership of over 323,000 Black-owned businesses. Black Americans have just recently seen America write a check for nearly $2 trillion to stimulate the small business community. And during this time when we're looking to elect not only presidents, but a slate of Democratic representatives across the country, Black Americans are saying it's time to have a financial conversation about America's financial obligation to them as well. To address these issues, we must look at just not the social concerns, the judicial concerns, as well as the economic conditions. And the U.S. Black Chambers, the national voice of Black businesses, leading the way to ensure that all 2020 political campaigns are reflective of the urgent needs that the business community faces. Black business owners are a unique voice. We're unique voters with unique hybrid issues that deal with an intersection of race, social issues, small business policies, and the economy. Amidst the current virus, the pandemic that crippled our nation's economy, we saw over 41% of Black businesses close. That represents 450,000 Black businesses were forced to close their doors between the months of February and April. If we fail to create a policy agenda that is tailored to the needs of these underserved entrepreneurs, foreseeing challenges will continue to burden the shrinking number of Black businesses in the years ahead. In particular, to accomplish these agenda, candidates must formally plan to do the following. First, they have got to make sure that there's transparency in contracts being awarded by the federal government. They must champion procurement opportunities for Black-owned businesses. Under the Obama administration, there was the Quick Pay program that was initiated. We insist that that program be put back in place. It's a great opportunity, and many of our Black-owned businesses grew through the government programs. such as the 8A program, but it leaves no idea of future. If I get a contract on January 1st and don't get paid until June 15th, I could end up going out of business. We must look at expanding broadband across the low and moderate incomes, LMI communities, to ensure that Black business owners are equipped to operate in the growing virtual society. We must grow the opportunity for strong transnational commerce by opening the international relationships with Africa. We must increase the infrastructure investments in Black communities, while also growing the number of federal contracts for Black firms. We must purchase media from Black-owned companies for the 2020 campaign cycle. We also must support historically Black colleges and universities, as we know that in order for there to be sustainability in our communities, we must hire the Black talent that comes from our historically Black colleges, similar to Florida A&M. You can find out more information on the U.S. Black Chambers at our website at www.usblackchambers.org, and you can learn about our 2020 Black Print agenda. In the plan, we provide current solutions for policymakers to safeguard Black communities in the weeks and months ahead. Thank you.
And I would be remiss if I didn't take a moment of personal privilege and send you a virtual Rattler strike. All right.
Strike again.
That's right. All right. For our first question, we will go to Mr. Graves.
Thank you, Mayor Bottoms. And Ron, it's so good to see you. Thank you for all the work that you do every day to support thousands of Black businesses across the country in advocacy and through your programs. As you know full well, due to systemic issues, including racism, Black businesses have not thrived nearly as well as they should have for many, many decades. One of the biggest challenges that Black businesses face is the access to capital. What recommendations do you have to help increase access to capital for all of these Black businesses that today are even facing more difficulty than they have in the past?
Great question, Don. It's also always good to see you as well. The U.S. Black Chamber laid out what we were looking for from policymakers, government, as well as corporate America and general consumers. And from policymakers, there are things that we think can be done to increase access to capital. If you ask any small business, their number one concern, they will say access to capital. But when you ask a business owner, they will say number one, number two, and three. There are barriers that are there placed upon Black business owners that our counterparts from our majority community don't face. But there are certain things that you can do, such as the Quick Pay program, that has nothing to do with access to capital, but it shores up my ability to have cash flow. Again, if I can get paid within 15 days, I don't need a loan. I understand that the majority of Black business owners don't have real lines of credit. We can address that both through policy as well as what our corporate partners are doing. For our corporate partners, if they have $100 million or more in assets, deposit those 15% of those assets into Black-owned banks, historically Black CDFIs, so where we know those funds are going to get to us. And when there are opportunities such as the stimulus package, don't call it a payroll protection plan, where we know that the majority of Black business owners don't actually have payroll, but they have contractors, they have 1099 employees, but weren't able to actually qualify for the funds that were being distributed across the country to help us have sustainability.
Thank you for those really great recommendations.
You're quite welcome.
Thank you. And next, Congresswoman Garcia has a question.
Thank you, Mayor, and thank you, Mr. Busby, for your remarks. And I'll pick up where you left off. If you don't want us to call it the payroll protection program, I'm curious to see what you think we should call it. But more importantly, how can we design future relief packages to, like the PPP, to be more inclusive and to really reach the minority-owned businesses?
Well, I think having advanced understanding and transparency. We all know that when the $349 billion conversation came about, everyone was excited about it. That happened on a Friday afternoon, and by Saturday evening, 50 publicly traded firms had really taken up $250 billion of that. And there was no accountability. There was no questions of how the funds were going to be spent, if they were being addressed. But yet, when it was a small business owner opportunity to be able to participate, there were several criteria. And now in the forwarding package that are being discussed, there are even more questions. We want the same opportunities the larger firms were able to be able to participate. We want to be able to understand it on the front end, and we really want to understand transparency. When we started as the U.S. Black Chamber talking about 35 to 40% of our businesses were going to close, nobody really understood what wanted to hear. Once Bloomberg said 41% of our firms closed, it got people's attention. The way you get attention is real data. Currently, there's no data, so we're having emotional conversations versus having conversations that are based on data. We want to see who received the checks, how much they received the checks, what industries they were in. We understand that almost 40% of Black businesses are in 5 industries. We would have much preferred it be an industry-specific stimulus package so that we know that the businesses that we own and operate could have participated versus just it being a small business package where you had a mom and or pop company competing against the Los Angeles Lakers.
Thank you.
Thank you.
Thank you very much, Mr. Busby. Now we'll hear from Dr. Mona Hannah Atisha, MPH, who is a pediatrician and professor at Michigan State University and the Hurley Children's Hospital Pediatric Public Health Initiative.
Hello, thank you for this amazing opportunity. Thank you, Mayor, and thank you for everybody on this committee. My testimony comes to you from my perspective as someone who's recently recovered from COVID, but also as a pediatrician, as a scientist, and a public health advocate in Flint, Michigan. In 2015, I helped uncover another preventable public health injustice, the Flint water crisis. And since then, I've had the privilege to work on our recovery. My testimony for you is modified from an article that I wrote about a month ago for the New York Times in a series called America That We Need, called I'm Sick of Asking Children to Be Resilient. So a baby born in Flint, Michigan, where I'm a pediatrician, is likely to live almost 20 fewer years than a child born elsewhere in our same county. She's a baby like any other, with wide eyes, a growing brain, and a vast, bottomless innocence. Too innocent to understand the injustices that, without her knowing or choosing, have put her at risk. Throughout the United States, geography defines and describes inequities in health, wealth, mobility, and longevity. The reasons for this are both visible and hidden. Life in a distressed neighborhood like Flint means limited access to healthcare and healthy food. It means living with violence, racism, poverty, and uncertainty. It means bearing the brunt of environmental injustice, not having safe and affordable water, as Flint knows too well, or living in the shadow of a polluting factory. These disparities between neighborhoods are rarely accidental. They are a product of purposeful policies and practices that have widened gaps in income, opportunity, and equality. Over the decades, city inhabitants have been battered by deindustrialization, racist banking and real estate practices, white flight and population loss, austerity cuts to public education, public health, and safety net programs, the corporate-driven weakening of our unions, of environmental regulations, housing and nutrition insecurity, police brutality, and so much more. And as a pediatrician, I know the science that when children are exposed to multiple adversities, both in their home and in their neighborhoods, they have greater challenges later on in life. These constant pressures change children at the molecular, cellular, behavioral level and make them sick. Exposure to, say, 6 or more adverse childhood experiences can cut a child's life short by 20 years. The will to survive and endure can be a deciding factor between a child who overcomes these adversities and a child who can thrive into adulthood. But how long can we ask people born in the wrong zip code to rise above and persevere in circumstances beyond their control? No matter how central that idea of overcoming is to our American identity. In 2019, a Rhodes Scholar talked about his journey from public housing in northern Philadelphia, where many of his friends were shot and stabbed to death, and he spoke a truth that we all need to hear. Don't be happy for me that I overcame these barriers. Be mad as hell that they exist in the first place. Surviving life's hardest blows should not be celebrated or expected. Recovery and reconciliation require reparations and resources. To expect resilience without justice is simply to indifferently accept the status quo. Just as the New Deal sprang from the Great Depression and public health best practices were born in response to a different plague, we need to embrace the bold innovations that are certain to arise. To begin with, we need to establish policies and practices rooted in science, and science tells us that where you live matters. For children raised in places like Flint, places replete with the stresses of misfortune, these adversities rooted in historic and systemic biases are scarring. Just as new COVID cases can represent a time lag from infection to 2 weeks earlier, adversities in early childhood play out later, filling our hospital beds and deteriorating our public's health. And medicine alone is not going to fix this. Medicine only contributes to 10 to 20% of health outcomes. We need to address the root causes. This means mandating universal basic income and living wages for a start, and enhancing health and safety protections, along with benefits like paid parental and sick leave. This means establishing desegregated and well-funded public education starting at childcare as a fundamental right. Universal health care needs to be untethered from employment and free of racial disparity, and environmental health regulations need to be strengthened and enforced, not weakened, so that all children, no matter the zip code, can breathe clean air and drink safe water. These bold and big ideas are not new. These are proven measures to improve health, quality of life, and longevity, standards that most developed countries already employ. And to ensure that we are moving in the same direction together, the pathogens of divisiveness and bigotry need to be treated as the deadly, life-shortening contagions that they truly are. Rather than hoping that a child is tough enough to endure the insurmountable, as we often do in pediatrics, we must build resilient places, healthier, safer, more nurturing, and just, where all children can thrive. This is where prevention and healing begin, but this is how I believe we can build back better. Thank you.
Thank you. Our first question is from Anna Lilia.
Thank you. You got it right that time, Mayor. So Dr. Mona, thank you for all you do. I'd like to ask you to just speak a little bit more about the ways in which you see the current pandemic will exacerbate these existing disparities in health outcomes, particularly vulnerable communities, the working poor, vulnerable families, predominantly Black, brown, poor communities. How do you see it exacerbating not only in terms of the pandemic and COVID itself, but existing disparities in terms of outcomes around diabetes or preventable disease, access to care, et cetera?
Yeah, so we learned a lot from our last public health crisis in Flint, and we learned that not all burdens are shared equally by communities. And in Flint, we already have every disparity you can imagine. Like I said, we have a 20-year difference in life expectancy because of where children live, increased asthma rates and infant mortality rates, and the list goes on and on of these pre-existing disparities. And on top of that, we were hit with COVID, just like so many of our underserved communities that are predominantly poor and predominantly minority. Outside of the Detroit area, Flint was the next highest hit communities. We have over 200 deaths. We have more deaths than several of our states, in our little county. So here we are, already a community rattled with so many toxic stresses, so many disparities, so many adversities that have these kind of graded and life course trajectory consequences. And then we are once again disparately hit with this pandemic that will further widen health outcomes, that will further widen development outcomes. And as a pediatrician, I'm most concerned, but also about our education outcomes for our children. Here are kids who already had implications for their health and development from our last crisis, and now this disparity, lost education, lost high quality early education, lost enrichment has this potential to further widen disparities in really their success because of education gaps. So it is multiplicative, it is synergistic, and for our communities of color, predominantly minority communities, it is additive.
Thank you.
Thank you.
President Trumka. Can you unmute yourself? We can't hear you.
Thank you, Mayor Bottoms. Dr. Motto, let me first thank you for your testimony, but let me also thank you for the work that you did in uncovering the Flint water crisis and the work you're doing in leading the recovery at the Pediatric Public Health Initiative. And one other thing I want to thank you for, and that's for being on the front lines, working with patients every single day, despite the risk to you and your family. We owe you a tremendous debt of gratitude. Let me say this, from what we know about the existing health disparities, what are some of the reasons why people of color are contracting the virus and dying in disproportionate numbers?
That's a great question. It's great to see you, and thank you for your kind words. So there's many reasons that people of color are contracting this virus more than others and getting sicker and ultimately dying more. Michigan is an example where 40% of our deaths are Black individuals, whereas Black individuals only make about 14% of our population. This is also not unique to Michigan. So why are these disparities? Why do we have these disparities? Some of it is because of pre-existing conditions, which are rooted in these early adversities. So when children grow up with racism and poverty and, poor schools and, all the lack of nutrition, all these compounded toxicities, they can change your immune system, they can change your nervous system, they can change your endocrine system, which lead to these chronic conditions like obesity, like diabetes, like heart disease, that then put you at greater risk for conditions like COVID. Communities of color also suffer from pre-existing environmental injustice. For example, these communities are often in places where there's poor air quality. We are also seeing now a greater association of what happens. There's a greater incidence of COVID cases where there is poor air quality. For example, Southwest Detroit has the worst air quality in our entire state because of gasoline refinery plants, and it is also a community of color. This is a pattern throughout our nation. There's also issues in healthcare and non-implicit biases of how we treat patients. So there's long-standing issues of why certain communities are impacted more than others. We have to get at those root causes, which are being highlighted right now with our conversations around Black Lives Matter. But we have to get at the underlying racism and the income inequalities, the fact that more folks are people of color are our frontline workers who are making sure that America has still been running throughout this crisis, that put folks more at risk.
Thank you, Doctor, for your testimony, but thank you more for your dedication to all of us.
Thank you. Thank you. It's a privilege.
And thank you, Doctor. And glad to see that you have recovered from COVID.
And no chance. Thank you.
Next, we will hear from Jason Nez, President of the Navajo Nation. Thank you for joining us.
Well, thank you, Mayor, Madam Chair, and committee members. Thank you for having me on the Platform Drafting Committee hearing. My name is Jonathan Nez. I am the President of the Navajo Nation. There are 350,000 Navajos all over the world, and half of those are living right within our sovereign nation. And just to give you a little perspective of what we're going through here on the Navajo Nation, we have tested 53,913 of our Navajo citizens. And we tested aggressively. 25% of our people have been tested. 1 out of 4 have been tested. And the positive tests, 7,469. Those 7,000 plus 5,082 have recovered. But I'm sad to say that 363 of our Navajo people have lost their lives to COVID-19. As we are flattening out and reducing our numbers here on the Navajo Nation, we see a spike happening all around us: Phoenix, Denver, Albuquerque, Nevada, and California. And so we are utilizing our own sovereign ability to help keep our Navajo people safe. And the health disparities of COVID-19, there are 5 high rates of chronic health conditions, which was mentioned, that most vulnerable population, diabetes, heart disease, cancer. I can go a little bit more in depth, but I'll save that later. Pre-existence of pneumonia and asthma is number 2. Number 3 is inadequate healthcare access. We only have 7 hospitals, IHS and self-government hospitals, that cover 27,000 square miles of Navajo land, which is equivalent to the size of West Virginia. Number 4, people and males are being affected more with COVID-19. 60%, 60 years old and over 65% have lost their lives to COVID-19. And then males is a lot higher than our women warriors. Number 5, socioeconomic and environmental factors. Because of the unemployment, high rates of unemployment, housing is a factor. Multiple generations of people living under one roof make it spread a lot quicker. And water and electricity, 30 to 40% of our Navajo people don't have running water. And food insecurities. We live in a food desert here on the Navajo Nation. So there is a history of broken promises and broken treaties. And we want the DNC to also recognize that let's not take Native Americans for granted in this election. And, IHS has been underfunded since its start. We actually want changes in regulations. I mean, if you could build a wall in the Mexico-US border by, putting all these laws aside or policies, why couldn't you do the same in Indian country? And, I ran out of time, but lastly, I just want to say that the CARES Act funding came in late. And while the rest of the country saw direct relief, we had to wait many weeks before tribes to get the monies from the CARES Act, and the United States citizens were given these dollars to help them through this crisis. But the first citizens of this nation were again set aside. And I think if we all begin to work together and help rebuild our nations, we could see the building back better of tribes throughout the United States of America. Thank you so much.
Thank you so much, President Nez. Our first question is from Congresswoman Howland.
Thank you, Madam Chair. Yate, President Nez. In December 2018, the U.S. Commission on Civil Rights Broken Promises report highlighted healthcare as one of the 5 areas where the U.S. has not lived up to its trust responsibility. And another one of those areas was housing, and you mentioned housing in your testimony. So that is an issue as well. And now we're in a pandemic. How has COVID-19 exacerbated health disparities on the Navajo Nation, on the Pueblos in New Mexico, and for tribes across the country?
Thank you for that question, Representative Holland. Here in the United States of America, tribes are looked at. 574 tribes are almost looked at as the same. We are distinct groups throughout this country. And so one fix, it's not a cookie cutter approach to dealing with tribes. And here for the Navajo Nation, we are the biggest nation, tribal nation throughout the country. But we have a hard time developing and improving the quality of life because tribal lands, trust lands, are equivalent to any other federal lands throughout the country. And like I was using an example for the building of the wall, you know, they had to set aside federal regulations and policies in order to get the material through BLM lands, parklands. But why couldn't we do the same in tribal nations throughout the world so that tribes and the people there can be equal to all the citizens here in this country? And it's quite interesting that a lot of money is spent in rebuilding other countries, war-torn countries, but yet right in the middle of the most powerful nation in the world, Native Americans have always been on the back burner. And that is a concern to not just me as a tribal leader for the Navajo Nation, but all tribal leaders throughout this country. Thank you.
Thank you.
Thank you. Our next question is from Dr. Gottney.
Great. Thank you, Mayor, and thank you, Mr. Nez, for your testimony. I'm wondering if you could speak a little bit more about the sort of relationship between the health issues that you are confronting in your community and the sort of other social inequalities that, you know, have been present in the community for a long time. And then, of course, piled on top of that, this problem of the pandemic. But I'm just interested in hearing about how you think that these other forms of social inequality are exacerbating the health issues at this moment.
Thank you for that question. Let me just highlight the resilience of the Navajo people, as well as the resilience of all tribes throughout this country. We've gone through some tough times in the history of the United States of America, but we have persevered and we have never given up. Even though there's a lack of assistance from this administration right now, you know, I'm sure they're going to take credit for the lessening or flattening of the curve and lessening of COVID-19. But let me just say that money came way later down the road to relieve us during this pandemic. So I want to say thank you to the many friends throughout this country, also to the Navajo people for coming together. And you can see examples of this happening clear across the country. You know, people are struggling, but we call it like five-finger beans. We're all five-finger beans, no matter what nationality we are. But we were able to come together and to unite and help each other. And that is what happened here. But there are some promises that were made because of a treaty that was signed in 1868 with the Navajo Nation. And that was better education, better health care, infrastructure. And to this day, we have yet to see many of those promises fulfilled. And that includes in the Indian Health Services, the IHS, where we only have 7 hospitals. Imagine that, in the size of West Virginia. And that is unacceptable. And I appreciate the United States citizen finally seeing what's happening in Indian country and supporting us shoulder to shoulder to let our congressional delegation know, and most importantly, this administration know that tribes should be in the forefront of economic and community development to catch us up with the rest of the United States of America. That's building back better.
Thank you, Mr. President. And my apologies to you. I think I misspoke when I made the introduction of your first name. So Jonathan Nez. So thank you again, Mr. President. We are honored to have you join us. Joining us next is Charles Phillips. He serves as the co-chair of the Black Economic Alliance.
Good evening. My name is Charles Phillips. I'm co-chairman of the Black Economic Alliance, and thank you, Mayor Bottoms, for speaking with us last week. We're a policy and advocacy organization for advancing work, wealth, and wages in the Black community. The organization was founded by 70 Black executives, mostly in New York, but now has over 500 members globally. My background is as a software executive, since I'm the former president of Oracle Corporation, CEO of Infor, and now managing partner at an investment firm that builds technology companies. I'm also on the board of the New York Federal Reserve. I'll be using some data from that. So the COVID pandemic exposed the fragility of the Black economy. We lost jobs and businesses faster and probably longer than the rest of America. These Black workers were already at risk because of automation and overconcentration on low-wage service jobs. So in Q1 of this year, before all this started, we reported weekly earnings in the Black community of $775. That compares to $979 for whites and $1,200 for Asians. Of America's 6 million contingent workers, i.e. the gig economy, they're disproportionately Black and Latino and lack health care, workers' comp, employer contributions to Social Security, and pensions. So what happened at COVID? Well, BLS reported Black unemployment at 16.8% at the end of May, compared to 12.4% for whites. But the important thing to remember is Black unemployment rose in May, while white unemployment declined. Whites are returning to work faster than we are, given that Blacks are concentrated in sectors that take longer to recover: retail, hospitality, laborers, and food service. Few of us have jobs in the digital economy where we can work remotely. One example is the New York City Commission I'm on is estimating 25% of restaurants in the city will close permanently. And this will last a while. Recent recessions have lasted 2 to 3 years. It's in the document. I have each recession listed for the last 3 that happened. And then it's taken another 4 to 5 years to get back to the pre-recession job levels and GDP. So we'd like to pivot. Now's the time to pivot and retrain Black workers in technology, construction trades, healthcare, and advanced manufacturing. These are the areas that BLS says is the high growth occupations in the US for the next 10 years. These middle skill jobs, those that require some training beyond high school, but not a college degree, represent over half of all jobs and a third of all the new jobs over the next decade. Research from Harvard shows that the degree inflation is pervasive for job postings. For example, 67% of postings for new production supervisors in 2015 required a college degree, even though only 16% of the existing people in those jobs had a college degree. Given the racial gap in college attainment, degree inflation has a disparate impact on Black workers. Companies are slowly shifting to skills-based hiring instead of degree-based credentials. The investment in job training makes sense for business leaders. It's their future employees. Given the demographic change, there's also future customers. You want them to have disposable income, also good for society. We have lots of plans on how to work that out, working through social entrepreneurs who train people for a living on a pay-for-performance basis. Our recommendation would be to redirect some of the federal spending on job programs to some of these social entrepreneurs who know how to do this very well. On the business side, you're probably already familiar with under PPP program. A lot of that did not make it to Black businesses. I won't get into all the reasons why. I certainly can take that. But the bottom line is we need more durable, larger, and more credit-worthy businesses. Most Black businesses are sole proprietors. Only 10% of those firms are profitable. Black firms were 29% more likely to be unprofitable, and 56% of them are considered high credit risk. Access to more capital, however, is not the full solution. 70% of them already have debt. What they need is other services to build better and larger companies. Upscaling with more training, successful businesses are more likely to have a core product or service that is differentiated and in demand. Companies based on advanced skills have a higher chance of success. Most often, entrepreneurs start businesses around a skill they already have. Technical advice: entrepreneurs benefit from the guidance of experienced operators and then equity capital. Black Americans have been unable to create intergenerational wealth, which explains the low median household wealth of about $17,000. That's 10% of the wealth of a white family. And that's partially related to all the things I just described. We need more differentiated skills, which will lead to higher wages and stronger businesses. Thanks for your attention. Happy to take some questions.
Thank you, Mr. Phillips. I would like to recognize Senator Rodriguez with our first question.
Mr. Phillips, thank you for joining us, and thank you for the important work you're doing, and thank you, Mayor Bottoms. The first question is recognizing the fact that during the pandemic, private citizens stepped up to provide financial assistance to minority-owned businesses. From your vantage point, what can the public sector do to engage, to provide support and amplify these initiatives?
Well, one idea will be to better capitalize the CDFIs, the community development financial institutions. Those are the non-bank banks that finance Black businesses. They can only lend so much. If they run out of capital, once they're tapped out in their balance sheets, they're lended to their limit, they stop lending. That's what's happened now. So they need more equity. There's a bill that Senator Warner and Senator Schumer are working on. I talked to them last week on this very issue. So capitalizing the Black banks and the CDFIs so they can continue lending, get some of the existing loans off their balance sheet, syndicate those out like we do with mortgage securities. And that way they're refreshed and can continue lending. So that would help a lot. And the second area would be the job training programs I talked about. There are lots of good training programs around the country. They tend not to be the complex ones that the federal government is currently funding. I would do more public-private partnerships and take advantage of the things that work that are linked to employers.
Thank you. And Secretary Vilsack has a question.
Thank you. Mr. Phillips, appreciate the opportunity to visit with you today and appreciate your testimony, especially as it relates to middle skilled jobs and job training. My question is specific not only to the need for capital, but how do you foresee the federal government providing this kind of job training and skills training to rural residents, people who live perhaps not in a city, but business owners and small communities all across the United States? I'd be very interested in your thoughts about whether or not what you proposed is applicable in rural places as easily and as transferable as in urban centers.
Not as easily, but it's still applicable. Number one, some of these jobs can be done remotely. Certainly digital jobs around, database administration or something like that. You can learn that remotely. Secondly, if this is funded and you have these public-private partnerships, you have these entrepreneurs, they will go wherever they're directed, where there's opportunity and demand. And so they've been followed by the employers. The employers tell them where to go. And so if the employers want to really service a rural area, they will set up a shop there. So I think it's possible to do both.
Thank you.
Thank you for your testimony, Mr. Phillips, and for the impactful engagement of the Black Economic Alliance.
Great. Thank you for what you're doing.
We will now hear from Lucas Mendieta and Nathan Perry, co-founders of the Cutting Edge Elite Inc., a staffing agency.
Business. Can you hear me, Mayor? Oh, perfect. Thank you for having me, Mayor, and the committee. But when COVID hit, we lost all of our event staffing business. So in a matter of seconds, $1.5 million right out the window. So we had to think fast and we had to pivot our business because there were no more parties to staff. So we shifted our focus to providing staff now as essential workers. So now we have a group of people that they go to a kitchen every day to box up food. We have another team who are delivering that food to elderly and people who just can't leave their homes, and another group who are working to produce PPE that gets distributed to businesses in need. And finding staff has not been easy because the way the system is set up right now, people are making more money just by staying at home. And this initiative that Nathan and I are doing, we're doing it at cost. So we're not making a profit off of it, but at least we're able to help our staff get a steady stream of income because a lot of them are freelancers and they may not qualify for unemployment insurance. You know, some of them haven't gotten their stimulus checks. Lord knows I haven't gotten my stimulus check yet. And our company didn't receive our PPP until the second round in mid-May, despite the fact that we applied for it the minute it was open to the public. And I know like how our team and how our people are feeling because, you know, having that fear of not knowing what the future is going to be, where you're going to sleep, if you're going to have a house. I've been there. When I was 16 years old, I was chased out of my house for being gay, causing me to be homeless on the street for a while. And I started this company with very little money, and Nathan and I built it to where it is now. And as leaders, we have to give 100% for staff and take care of them and be there for them. We got to step up now. They're part of our family. Thank you. Nathan?
Thank you, Mayor. And I'll finish this out here. I'm Nathan. I'm from Guatemala. I'm LGBTQ and CEO of the Cutting Edge Elite. As a minority-owned small business, we understand the need for and the power of community. We are here because of those who have helped us. With no profit, we had two options: close our doors or do what we can to get our people work. With community as a core value, we only had one choice. We launched Relief Division, and after delivering hundreds of thousands of meals to vulnerable populations in New York City and producing over 10,000 face shields daily for Manhattan hospitals, we can say we were able to keep over 30 field agents fully employed. In addition, we developed the Q program to get customers masked up and sanitized before going into stores. The key being training in humor, conflict de-escalation, and finding different reasons to unite. Accepting that whether for the virus, the economy, or others, if we wear this, more people will shop, and that gets us all back to work. This happened again by looking at our communities, other small businesses and where they struggle, and our staff's power, that of hospitality, adaptability, and massive resilience. This has also produced just enough business to support our full-time office staff of 8, along with the delayed PPP, which we finally got through the 10 KSB community lender that stepped in after other banks delayed. That empowered us to focus. Stabilized, we invested our time in COVID safety protocols and shared them among our communities. We're glad to share our experience with you, and thank you. Lucas and I both come from communities that have been told their greatest strengths are their greatest liabilities, as do many of our staff. And that is a lie. The communities of the US need leadership from the top down that says, I see all of you. That recognizes the varied experiences we all have as the power to help each other. Uniting people through care and purpose is what allowed us to accomplish our small part through this crisis. After all, if we can't love ourselves, how the hell are we going to love anybody else?
Well, amen to that. All right, thank you. Ms. Smith has our first question.
Well, thanks to both of you for your time today. Thanks for sharing your stories. Thanks for your ingenuity. It's an amazing story here of resilience, as you've noted. I'm just curious, I mean, do you envision a time when you will go back to what you were doing before a normal? Are you kind of carving out a new path for yourself right now? And you mentioned some of the steps that you're taking to keep staff safe. I know you mentioned PPE. Could you tell us a little bit more about some of the other steps you're taking to ensure the health and safety of your employees and staff?
Of course. Nathan, do you want to elaborate?
Yeah, you know, referencing that PPP, which caused people to be furloughed for a while until we finally got it, which I don't believe was the intention. Nonetheless, when we got it, we also hired a medical doctor to give us consultation and advice because we do a lot of event staffing and every event is different. Numbers of exits, how close people can be. So we've actually sort of become a consultant with a lot of our clients and a collaborator where they share what they've learned and we share what we've learned, which was so vital that we were stable enough that we could invest that time in it. We do hope that parties will be back again someday when they can be, but it was also a wake-up call to look at our staff and remind ourselves that they have a lot of key skills and there's a lot more where we can sell them and develop them and work with them to make more money for everyone. So it really has pushed us to expand our view of just what we can do.
All right, well, thank you to both of you. We appreciate you and happy Pride Month to you.
Thank you.
Joining us next will be someone who is on the front lines during the COVID-19 crisis. Trung Lee is a nurse in the Yukon Health System. Thank you for joining us.
Hello. Thank you, Platform Committee members. My name is Trung Lee, and I'm a registered nurse with the Intermediate Care Unit at Yukon Health in Farmington, Connecticut, and a member of the local AFT 3837. So caring for COVID-19 patients was very difficult with our broken healthcare system. For example, constantly donning and doffing PPE, which included gowns, face shields, and masks constantly to care for these patients, or wearing them for an entire 12 to 16-hour shift in a bio-contained area, watching patients struggle to breathe while on 100% full oxygen and seeing their faces as they realize they're about to be intubated and wondering if they will survive the situation. And even worse is trying to rush to put on PPE to help with somebody coding and trying to save their life, or having to watch from the sidelines and not being able to do anything because you're on the clean side and you can't cross over to the dirty side for fear of contaminating your own patients. So those are some of the issues while caring for COVID patients that we had to deal with. And unfortunately, no one will ever be able to quantify the impact of seeing our patients say goodbye to family members on FaceTime or Skype while struggling to breathe or even unconscious on the vent, and seeing their family members, say their goodbyes over a video, and wondering whether we ourselves as frontline workers will take the COVID-19 home to our families. I remember the day that I was tested positive, which was April 15th. I got it from a couple patients, unfortunately. Luckily for me, it wasn't too severe. It started with aches and chills, and luckily I was able to isolate away from everybody in a hotel room. But initially it was really tough because once the hotel found out I was positive, they kicked me out, and the hospital felt that it was a good idea to isolate me in the college dorm room. So having respiratory disease, I had to move myself and all my stuff out of the hotel room into the dorm room myself, and almost passed out. And being the only one in the college dorm room, no one would have found me until the next morning. So luckily, I was able to get by that. And with the help of my wife and union leaders, they aggressively petitioned leadership to allow me back into the hotel. And luckily, I was able to return and isolate for the remainder of my time there. So 2 weeks of total isolation with nothing but a phone to contact loved ones, just like a regular hospital patient. No contact with the outside world at all. Luckily, like I said, it wasn't anything respiratory. It was mainly all nausea, vomiting for me. I couldn't eat, lost a lot of weight, and luckily survived. I'm no longer COVID positive, but the virus, has left a permanent mark on me and all frontline workers. We deal with a lot of PTSD, which will always be present. I don't know about other hospitals, but UConn Health never debriefed any of their staff once the pandemic started to slow. We were just left to kind of comfort and debrief each other. So that's an issue that I don't know if other hospitals and healthcare workers are facing. But we're seeing record new cases of COVID spring up in hospitals with this new opening, and the Trump administration is continued with their lack of leadership and planning, leaving the states to fend for themselves and create their own plans. There's still not enough PPE to go around. I'm hoping everybody during this downtime is restocking heavily. A lot of our coworkers, including myself, my coworkers, never received any hazard pay for working on lines. Employers are getting a free pass on what they do on their policies. JCO has been very lax with their regulations and leaving the employers to decide what is safe and what is unsafe. So, the U.S. has 25% of the COVID-related deaths in the world, and I feel like this is unacceptable. So, thank you for your time.
Thank you so much for your sacrifice and all that you do. I just saw our COVID numbers. They're up almost 20% since last week. So hearing your testimony reminds us of how very real this virus is. So with that, President Trumka, to you for our first question.
Thank you, Mayor Bottoms. At the beginning of this pandemic, we were struggling to get PPE because this administration was so woefully unprepared. And because OSHA refuses to issue a pandemic standard, and they refuse to get involved in the enforcement of any standards that are out there right now. So I want to thank you for risking yourself and actually being infected while in the care of others. You've made many other lives a lot better, and we owe you tremendous gratitude for that. My question is, we hear hospitals saying that there should be enough PPE because you can just recycle used N95 respirators. Do you agree with that? And are you getting the PPE that you need right now?
Thank you for your question. Luckily, during the pandemic, Connecticut was 2 to 3 weeks behind New York City. So having seen what they went through, UConn Health, we were very fortunate that they were trying to scramble to get whatever PPE they could for our staff. According to some of the other staff at other hospitals, UConn Health was fortunate to be better. Their staff was better prepared than other hospitals. So, but did we have enough PPE? We had an adequate amount, but not enough. We were left with using recycled N95 masks. I know the standard for N95 is about 8 hours, but a lot of, including myself, a lot of my coworkers were using the same mask up to a week and then having them recycled and sanitized. And there was a recent publication that came out that said that sanitizing N95 masks destroys their integrity. So they're not sure if that's destroying the effectiveness of the N95. So here we are using recycled masks that were already a week old for another week. And I know in our hospital, we ran out of the hand sanitizer foam. So we were mainly washing our hands. And if we needed some foam, we had to call the housekeeping and the nurse supervisors to come deliver one bottle. And it was, guarded with their, with our lives sparingly. And the sanitary wipes that we used to decontaminate equipment, our shoes, other areas, we did not have enough of that. So our nursing assistants were left taking out single sheets, cutting them in half, and rationing them out in plastic bags to put in individual rooms, until we run out. So I find that to be unacceptable. Do we have enough equipment now? Now that there is a downturn, the hospital, I hope, is restocking. And luckily, during the pandemic, AFT National spent $3 million to get PPE, and luckily, some of that was delivered to UConn Health, and we thank AFT for that. So that helped us out a lot. So we had an adequate amount, but did we have enough? No. We were left using recycled stuff and scrambling to use makeshift policies and modalities that we could to survive in our next shift.
Well, thank you very much. And many of the unions, including the AFL-CIO and AFT, have been distributing PPE. We just sent more PPE out to Arizona because of the uptake out there, and they're running short. So we just want to make sure that frontline workers, essential workers like yourself, are never cut short again, and you don't have to jeopardize your health and safety and that of your family because you don't have proper protective equipment.
Thank you very much.
Thank you. And Congresswoman Clark has a question.
Thank you, Madam Mayor. And I want to thank Trung for being a frontline worker, being so essential to Americans in this crisis. And you've talked about the PPE. What else do you need to feel safe at your job?
We need cooperation with management. I feel during this time with the lack of policies and everything being kind of new and novel and lack of leadership on the national level, like I said before, states and individual hospitals were left scrambling to make their own policies on the fly, deciding on their own what was safe and what was unsafe for their employees. And if the employees spoke up, they were either let go or they were just told, you have to deal with it or find another job. And it's unfortunate, we're putting our patients first, and we're doing what we can to ensure our patient safety and our own safety and our family safety. And we feel a lot of times that there is a disconnect between leadership and the staff that are on the front lines. And I think hospitals that have that connection between management and staff are very fortunate, and I wish I was there, but I know many of the hospitals, the majority of hospitals, unfortunately, there is that disconnect between management and floor staff, because a hospital is a business. They need to make money, and unfortunately, a lot of the staff are expendable and just a number, and their bottom line is to make money and to appease the board. So I think initially that would be a main thing to help us as workers feel safe, besides PPE, of course. And when I was sick, like I said, they kicked me out of the hotel and decided it was a good idea to isolate me from a total isolated hotel room to communal living in a dorm room. And I had to do it myself. And luckily, when I was able to move out of the dorm room, I had some friends that I called, and they helped me move back, with distancing. Otherwise, I don't know if I would have been able to do it. It was not, anyone who thinks COVID-19 is a joke, I say firsthand that it is not. It is not pretty to be affected with COVID-19. And if you think this is some fake disease, think twice. It's real, and it affects everybody, young, old, doesn't matter the color of your skin, how rich you are, how poor you are, it doesn't pick and choose. So I think besides PPE, I think hospitals need to recognize that the frontline workers, not only nurses, doctors, but cleaning people, respiratory therapists, everybody who had to work during the pandemic to play their part, is an essential part of the hospital. And the happier the nurse, the happier the patient, the happier the hospital. It's common sense, and I don't know why money trumps all that, and they don't understand that a happy staff will bring in more money, more patients, more all-around satisfaction. So that's how I feel will help benefit the hospital staff feel safer, is if they have a problem, they feel management will help back them and make them feel safe, rather than everyone scrambling to fend for themselves.
Thank you, and thank you for that frank answer.
Thank you very much. We appreciate you. Please join me in welcoming Gloria Martinez. Ms. Martinez is an elementary school vice president.
Thank you, Mayor Bottoms and members of the Platform Drafting Committee for this opportunity to provide testimony today. My name is Gloria Martinez. I'm a National Board Certified Teacher in Special Needs and have 19 years of experience teaching, and serve as Elementary Vice President of the United Teachers Los Angeles, or UTLA. As UTLA's Elementary Vice President, I am honored to represent my colleagues, the teachers, education support professionals, and specialized staff, like school counselors and social workers, who teach and support students every day. Wherever we work, we share the belief that all students in our public schools, no matter where they live or their race or ethnicity or family income, should have an education that prepares them to be good citizens and contributing members of their communities. The COVID-19 pandemic has put a spotlight on what we knew to be true before the pandemic hit. Not all families have the same fair shot, not all neighborhoods have the same amenities, and not all public schools or college campuses have access to the same resources to help their students thrive. To be blunt, the pandemic has provided plenty of examples of the institutional racism that is present in our country. And Black and Brown families have been particularly hard hit due to lack of consistent access to quality healthcare, healthy food, and safe housing. We must make different choices for our students, particularly Black and Brown students, if we want them to succeed. Our students need more art and music classes to help them create masterpieces, not more test prep. Our students need more libraries and fully equipped science labs to help them imagine their futures, not more standardized tests. Our students need more social workers, more counselors, many more community schools, and more trusted campus aides and full-time faculty at institutions of higher education instead of the increasing integration of police officers into schools. As UTLA has said before, we must ask ourselves a fundamental question. Why have we, over the last decades, increased police presence in schools in communities of color, especially significantly Black schools, while we have allowed the academic and social emotional supports to be cut? The answer is institutional racism and an implicit acceptance of a culture that criminalizes Black students, and we must break that cycle. We must make different choices for our students if we want them to thrive. The COVID-19 pandemic has made our fight much more urgent and much more difficult. It has deepened the disparities that already existed and prompted budget cuts that will devastate students, especially those in Black and Brown communities, those who experience learning with a disability, and those living in rural areas. Some schools and students were able to make the switch to online learning relatively easy, while other students could not make it at all. When schools and campuses reopen, we will have to figure out where our students stand instructionally and emotionally as they deal with anxiety, fears, and tragic losses that have occurred because of the pandemic. I urge this committee to address the needs of our students with disability as the discussions for reopening begin. Our most vulnerable students, including our most medically fragile, need a plan that addresses their individualized needs. We can do this by finally making good on the promise that is the Individuals with Disabilities Education Act, IDEA. Many of our students with disabilities will need additional services to address any regression and continued services to help them fully access the free and appropriate public education in the least restrictive environment they deserve. To deliver on the promise of justice to our students, the bottom line is that districts must spend more and not less. Although we are grateful that the House has acted on the HEROES Act so that districts have the funds they need, we ask that future COVID-19 relief packages maintain the protections of IDEA and help us ensure that students with disability continue to receive vital supports and services. It is time for the Senate to stop stalling, especially if we are to reopen schools safely with classrooms and other spaces retrofitted for social distancing and personal protective equipment for students and educators. No doubt, all of these expenditures will be a major challenge, particularly in districts that never recovered from the Great Recessions. Cutbacks that have from the recession caused 300,000 educator layoffs. Already, nearly 500,000 public educations have been lost because of the pandemic. And according to NEA's analysis, nearly 2 million educators will lose their job over the next 3 years. This would be a disaster for students in schools that are already under resources. These students desperately need to return to schools with resources to help them recover and thrive. We know we can address the fallout from COVID-19 and also address equity challenges that have plagued us for generations. Let us make choices to bring about a new day that our students deserve. The best pathway in making the better choices is simple. Ask the educators what they think. We don't just go to work every day, we answer a call to serve. In today's society, educators are the most trusted professionals in their field. And we know our students by name, we know what students need, our input is essential. As respected and valued professionals, educators like me, we should have a voice in all decisions affecting our public schools and in empowering the next generations of students to take their rightful place to lead our nation forward. Thank you again, and I appreciate the opportunity to represent sisters and brothers here today.
Thank you, Ms. Martinez. After virtual learning with 4 children this year, I just think that you deserve all the money in the world for what you do. Thank you for what you do on behalf of our children. All right, our first question is from Dr. Gottney.
Thank you, Mayor. And thank you so much, Gloria, for your powerful testimony and in general for being such a strong and outspoken advocate for educators and for public education. And thanks so much to the UTLA, one of our country's greatest unions and truly progressive unions. So shout out to UTLA, we really appreciate you. In your testimony, you identified the very serious and acute inequalities in our education system. that have been building for many years, not just as a function of COVID-19, but problems that COVID has certainly exacerbated. And you said that we need to start making different choices for our students if we want them to thrive. Can you speak a little bit more about that, about what different choices we as policymakers and as a party should be making?
Sure. Thank you, Dr. Gottney, for the praise and for that question. Well, I think there are certain things that we can do as a party, which is prioritize children and education in this country, public education more specifically. I think that I mentioned in my statement, being true to the promise of IDEA should be one of the leading pillars of the DNC. I believe that Title I funding is also very necessary to ensure that students in our most vulnerable communities are making the progress and have the access to equipment that is necessary for them to thrive. We also need an investment and an exploration in better serving and understanding and helping the model of community schools grow across the country. If you're unfamiliar with community schools, I would love to share resources to the folks that have brought this panel together. But I think that community schools really addresses community issues. And we know that as schools are the pillar of communities, I think it's necessary for them to really represent the needs of the community that it serves. And so those are some ideas. I also think that there is a need for us to address curriculum and the implicit biases that our students learn about. I think this is very necessary considering what we're seeing, this uprising that we have not seen in over 50 years, probably the greatest civil rights uprising of my generation that I'm so proud to be witnessing and to be contributing in any small part that I can. I think that that is also necessary. And as an educator, what I've seen, unfortunately, I'm out of the classroom serving as vice president, but what I saw many of my colleagues struggle with is technology. How does a city like Los Angeles, in a state like California, have the audacity to fail our students with technology? I can't imagine what it's like for more rural neighborhoods and communities, what is more challenging for districts that are not as well situated as LAUSD to move in a direction to provide connectivity for all students. Those are some of the ideas. I can go on and on, but I know I am limited in time. Thank you for the question.
Thank you. Thank you, Ms. Martinez. Senator Rodriguez.
Vice President Martinez, thank you so much for your advocacy. Thank you for being a teacher. Thank you for your strong words that you're sharing with us. We share in support of ending systemic inequality and promoting the prioritization of our public schools. We know, you speak about respecting and valuing teachers. We know teachers do an important job. We know that teachers have a challenging job, but we also know that, particularly in states like Florida, because of the decision makers and policies that have been in place, oftentimes it's a thankless job. So again, thank you for what you're doing. As Chair and Mayor Bottoms mentioned, with a lot of us are parents. My wife and I have two very young children. But with distance learning, you're a special education teacher, and you've started to share with us some of the challenges that you've faced with distance learning. Could you tell us more how you have been able to connect with your students as a special education teacher, and obviously in your role representing other special education teachers?
Thank you very much for that thoughtful question. I must say, first and foremost, I taught both general ed and special education students. And because of the Great Recession in 2008 that I referenced, I was semi-forced to go into special education because I didn't want to leave the community that I was teaching in. And it's been one of the greatest decisions I've ever made in my life. And and I love teaching, and I miss the classroom every single day in this new position. But I also get to advocate for exactly what you mentioned. And so I think, one of the toughest hurdles for us to overcome was in reaching students, especially our most moderate to severe students, and providing the necessary services that they are offered through FAID, through their IEP, and in the least restrictive environment. Some of these hurdles, unfortunately, we weren't prepared to overcome initially, but what I saw was, teachers, like with everything, rise to the challenge in order to meet the best that we could the needs of our students. Unfortunately, without the proper guidance from the Department of Education, it was really hard for us. I think Trung spoke to this when he spoke of policy needed in the hospitals. It was difficult for districts and states to provide guidance on delivering remote learning for our more moderate to severe students, or even students with IEPs, because we were awaiting the guidance from the Department of Education. And so I think that what we can do when we do finally reopen schools is really think about what services are our students going to need once we are back into brick and mortar, whether it's a hybrid model where students get to be at home remote learning for a bit, or whether they are in actual school campuses. I think that's the more important question, because we're going to see a lot of our students that didn't receive services during this time because many of them were one-on-one, many of them are hands-on. We're going to need students that need more specific and more time with different practitioners, occupational therapists, speech and language therapists, etc. And that's why I think it's crucial for us to look at the promise of IDEA. That's why I think any future relief package has to specifically call out for money for our SPED students, so that it doesn't go into the general fund, but is actually allocated to address the needs of our special needs students.
Thank you so much, Vice President Martinez. You've highlighted so many important issues, including access to technology and really the need for broadband connectivity throughout our communities. We appreciate you.
Thank you.
Next, we will hear from Barb Caruso with the United Food and Commercial Workers Union. Thank you for joining us.
Thank you. Good evening, members of the Democratic National Committee. My name is Barb Caruso, and I'm here on behalf of the United Food and Commercial Workers Union. UFCW represents 1.3 million workers in grocery stores, meatpacking plants, healthcare facilities, and many other essential businesses. Here in Ohio, UFCW Local 880 represents approximately 21,000 members in grocery, retail, and meatpacking. UFCW workers have been on the front lines of the COVID-19 pandemic since day one, and they continue to put themselves in harm's way today to help keep our families fed and safe as the pandemic continues to devastate communities across the country. UFCW just reported that in the first 100 days of the pandemic, our local unions confirmed that 230 workers have died from COVID-19, and nearly 29,000 workers have been infected or exposed to this killer virus. Our union recently held a national press call about the need to protect America's essential workers, and the UFCW announced 3 new initiatives in response to the growing increase of COVID-19 cases in states across the country. The initiatives to address the impact on frontline workers include reinstate hazard pay and establish a $15 an hour wage for frontline workers, establish a public mask mandate in all 50 states, create a national public registry to track COVID-19 frontline workers' infections, which would require companies with more than 1,000 employers to submit monthly reports on workers' deaths, infections, and exposure. Additionally, our union is calling for all candidates and elected leaders to require slower line speeds in meatpacking plants to ensure workers can properly social distance and be safe while they're at work. Meatpacking workers across the country, including the UFCW hardworking members, must be kept safe to ensure the food supply remains stable during this crisis. As the virus continues to wreak havoc on our country, we need a democratic platform that not only understands the continued dangers that our members face, but one that will support initiatives like these and protect all frontline workers as they continue to serve our communities across America. We need candidates that understand that worker safety is a priority. We need candidates who understand that this pandemic isn't over and hazard pay must continue along with extended unemployment benefits for workers who are impacted by this virus. We need candidates who understand that OSHA must work with unions to ensure the proper workplace protections are in place. And we need candidates who will stand for America's essential workers by protecting their pensions for those who continue to work and expose themselves to this virus day after day, ensuring that workers have the safe and secure retirement that they have earned. As we have witnessed historic shocks to our country and economy these past few months, we have also witnessed the power of workers standing together to make their voices heard in their workplaces to make them better and safer. All across the country, thousands of workers are embracing the power that they have when they are united by making their jobs better by joining unions like UFCW. We need candidates who support the rights of workers to stand together for the better wages and benefits that they've earned and they deserve. With your support, we can show America's hardworking women and men on the front lines of this virus that they are truly essential and raise the standards for all of American workers. Thank you for your time.
Thank you so much. Secretary Vilsack has our first question.
Thanks, Mayor. Barb, first of all, thank you to you and your brothers and sisters at the UFCW for taking care of my family and taking care of America's families in terms of providing quality, safe, and affordable food. I think we sometimes take for granted the incredible work that you all do in making sure that we are able to feed our families. So first and foremost, thank you. And secondly, certainly want to acknowledge that they are indeed essential workers, especially in this time of crisis. Having said that, I'd be interested in your thoughts about whether or not your brothers and sisters who are working in these meatpacking facilities, incredibly hard work, whether or not you feel and they feel safe, whether they feel that their employer has done everything that needs to be done and has taken steps to ensure their safety. And if not, what additional steps do you think the major meatpacking facilities need to take beyond those that you've already addressed to make sure that workers in those facilities feel safe and secure?
First of all, thank you for recognizing the important work that all of these essentials are doing in their workplaces. As far as the meatpacking facilities go, there's so many things that are very difficult for the workers that people I don't think really understand on how they do their jobs. When you process a piece of meat, a lot of times from the very first moment it's put into production, everybody has to work until it is completely done and run through all the plant. These workers work at enormous speeds. I'm often in all of them, and they work shoulder to shoulder. So it is very difficult to social distance. It's impossible. They have put protections in place the best that they could. However, unfortunately, it was a little bit too late. I'm sure that you've seen, all of the articles across the country about how many thousands of meatpacking workers have contracted the virus or tested positive for the virus, because often they live together. And in all honesty, our members do not feel safe. The only thing that really has changed for them is some of the employers have tried to make it much safer by putting up plastic in between them or shields in between them. And I honestly think that the only way to stop the spread in these type of facilities is by lowering the line speed and spreading people out. Yes, they probably cannot produce as much as they normally would, but there still would be enough supply to feed America. I truly believe that.
Thank you. Next, we have a question from Dr. Allen.
Thank you, Madam Chair. Ms. Caruso, thank you for being here. Thank you for your testimony. And thank you for your 45 years of service, I read, to UFCW. We very much appreciate that. I come from Delaware, and we actually have a significant industry, as you know, and have faced many of the challenges you've outlined in the lower part of our state here. My question is really on what I think is too under to the mental health, the toll it's taken on the mental health of your brothers and sisters experiences. Can you talk a little bit about that as it relates to their morale and the ill effects of not being able to do some of the things you've outlined on mental health, and any safeguards that you would recommend putting in?
I do believe that their mental health is suffering, especially when they find out that someone that they either rode to work with, because many of them carpool or ride vans to work, and so they are in close contact, even though they wear masks. We made sure we provided them to them early on. But they get a letter from the local health department, through the tracing, and they're told that, not necessarily the name of the person, but they're told that they were in close contact for an exposed amount of time to someone that has tested positive. And the letter says that you should quarantine for 14 days, and then it gives a list of things they should do during these 14 days, which is pretty much just stay at home. And if they don't do that, they could be up against some criminal charges. Well, a lot of them don't even understand that. The first people they call is us, because the local health department sent them this letter, but they're still mandated to go to work by their employer the next day because of the order that President Trump has put into place. And we have to explain that to them. We explain, the difference between them and a worker at a different type of facility that is told to stay home for 14 days to be sure that they're well. We have to explain it to them, and then they spend the next 2 or 3 weeks in fear that they're going to have the virus. So I think that their mental health is suffering, very much so. And I believe that they should have a form of benefit with help to be able to talk with someone about those things.
Thank you very much.
Thank you.
Our final question for Ms. Caruso is from President Applebaum.
Thank you, Mayor. Barb, it's good to see you. It's good to be with the sister from the UFCW today. And I think you made a lot of important points in your testimony. I know how horrific conditions can be at meat packing plants including and especially poultry processing plants during this period. You spoke about the line speeds, and it's my understanding that in the plants you represent, the line speed could be as fast as 146 chicken going down the line in 1 minute. And that has terrible impacts for people, especially during this period. My question for you is really this. The Trump administration has actually waived the line speed for many plants, meaning that the plants can operate their lines faster than 146 birds a minute, when it seems like we should be doing the opposite, slowing them down. Do you think that was a mistake by the administration to waive line speeds to make the lines go even faster? And if we were to slow down line speeds, we'd be able to protect workers not just from COVID-19, but from other health and safety issues as well. Thank you.
Thank you, Stuart. It's great to see you again, too, brother. What you just said is absolutely amazing to me, that he could eliminate the line speeds. The UFCW has been fighting for several years to slow them down in the first place. And now during this pandemic, and with so many people being out, it even makes it that much more difficult for the workers, which creates even more injuries because these are repetitive motion jobs. So there are very many similar injuries constantly. So I would not say it was a mistake. I would say it is absurd. And I would like President Trump to go work in a meat processing plant for just 1 hour to see if he could do it. Because it's already difficult even before the virus. So yes, it was more than a serious mistake.
Well said.
All right.
Thank
Thank
you.
you very much.
Thank you.
Next, we will hear from Silvana Salcido Esparza, who is the chef at the Barrio Cafe Gran Reserva. And my apologies if I didn't get that right.
Buenas tardes, alcalde, and members of the drafting committee. Mi nombre es Silvana Salcido Esparza, and I'm an award-winning queer chef and restaurateur from Phoenix, Arizona. Recently, I was awarded my 8th nomination to the James Beers Award, and this time I'm a finalist during the pandemic. I'm a finalist for the restaurant that I had to close because of this pandemic. Ironically, right? So I was forced to close because I had to close the little restaurant to save my flagship 18-year-old restaurant, Barrio Cafe. It was thriving for 18 years. It's been a blazing restaurant. So I'm sitting here looking at this pandemic. I know how to deal with health issues, with food, but a pandemic is something I'm not prepared for. So I looked for leadership and there was none. So my business partner and I hashed out a plan. We temporarily closed both restaurants. I started up a community kitchen, and she goes off and manages any programs that may arise because of the pandemic. We paid our employees to stay home and stay safe. We paid the core employees at 43, we paid 23. And then we went to work. As time passed, it became obvious and that this was not going to be a sustainable business plan for us. So we made the painful decision to close our award-winning and culturally important restaurant, Barrio Cafe Gran Reserva. We were forced to close because on a Friday, with a Monday appointment, the government said, no más dinero, no more, that's it. So on a Saturday, we closed the restaurant to save the larger restaurant. No more PPP money. Trump himself had promised to all of us, not just the elite and the privileged. So for a minute, I thought, is this really going to happen? And, you know, I'm a Latino-owned business owner that has been left out to dry in this hot Arizona heat where I'm from. In fact, where I'm from, we're ranked last in administering the PPP money by the SBA. We are, speaking of Arizona, I just want to point out that it's been over 100 degrees for weeks now, and our COVID rates have been going up for weeks now. So this totally points to the lack of leadership. You know, I realized that Donald Trump was using this one more way of fanning those flames of systemic racism and that cronyism. You know, I got the door closed in my face, and it wasn't because I cried in public because I closed my beloved restaurant that I got PPP money for my larger restaurant. You know, we're having a resurgence because of lack of leadership. That's the end of that story. And because the community at large hasn't known what to do. So they've been walking around without a mask. They've been thinking it's okay. But it goes back to the lack of leadership and its epic mishandling of this COVID. You know, it all goes back to those essential workers, right? The meat plants, the restaurant workers, the people who pick your produce and your tomatoes and the food we eat. And who is going to bear the brunt of this virus if not people who look like me, people of color? We've been doing it for years, and now this just has been an excuse to really put the weight on us. I remember leadership in a former administration. I remember the Recovery Act, $800 billion administered correctly, which followed through. Follow through is key. And, you know, during a pandemic, leadership gets towards standing up and being a leader, not paralyzed in fear. So it's obvious that we need character and leadership in the White House. And that's all I have for you today. I have to say that systemic racism is obvious, and during this pandemic, a magnifying glass came out and really showed the world what we're made of. Thank you.
Absolutely. Thank you. Our first question is from Congresswoman Garcia.
Buenas tardes, Silvana, and thank you for your comments. You certainly have given us a lot of food for thought. Regrettably, you know, I did Google your restaurant and I saw that it said permanently closed, so I won't get to eat the food at your table. But you certainly given us a lot of food for thought. And I was just wondering, you know, what does the future hold for restaurants? What will restaurants look like after COVID-19? Your main restaurant has survived, your second one has not. So what can we expect in the future for restaurants and the entire industry?
Well, we were already attacked, you know, culturally, appropriating cultures and lack of respect for culture is under attack. So restaurants, as we knew them, were already changing. Post-COVID, it's not going to be the same. Look, I feel like we're working in a fishbowl. This weekend I opened a pop-up for the first time, almost 4 months of being closed. And I opened a pop-up with a little window this big, with many layers of protection for my staff, right? Before we opened up for business, somewhat as usual, restaurants did not have a spike. We opened up for your usual business, and there's a spike. There's clusters of restaurants here in Phoenix that the entire staff is getting sick. I'm a 18-year-old restaurant. I've been with people that work with me, not for me, over 24 years. And I'll be darned if I'm going to get them sick because I was afraid to close my restaurant. You know what? If I close my restaurant, I'll open up a taco stand. I'm not afraid of failure. I'm resilient. What I'm afraid of is the leadership and the lack of little guys like me. Listen, I'm kind of privileged. I'm light. If you Google my face, you see that I'm very light. But I got phone calls from senators offering me back doors into PPP money, and I refused to take it because that made me no better than Ruth Chris. ¿Me entiendes? No better than it. I'm not going to take advantage of that. I'm not going to take advantage of that privilege. You know, and lack of leadership is definitely, well, I had a resource in my own leadership. And that's what individual owners are doing. I've been talking to many, many chefs and restaurant owners. And we're like, what are you going to do? No, I'm going to do this. I'm going to do that. Is that safe? What's going to happen? I made friends with restaurant owners that I didn't even know before. And, you know, we got a community that's come together and we're trying to figure it out. But our voice as a little guy is not strong enough, you know. Apparently, you know, you got an archaic restaurant that is not essential. $100 filet mignon is not essential for American health, for the health of our economy. It's not. That's just privilege. And who got the money? The privilege. A little guy like me, a lesbian, spectacular food that gets copied every day. And who gets the copy? Who's going to survive if not mediocre, subpar flavor? Why? Because the little guys, the ones with the flavor, they went out because we don't have the business lines. We don't have the bank won't talk to us. It was very magnified during this whole COVID PPP. It was like we say in Spanish, una payasada. It was a clown show.
No, no era payasada y le entiendo muy bien. La cosa es que, ¿qué vamos a hacer para todos los otros negocios pequeños? I mean, I understand you. It wasn't a funny act at all. Our job is to find out what you think we need to do to keep restaurants open post COVID-19. Do you have any suggestions? Because we're here to listen.
I do.
Okay.
The first thing that came to mind was maybe a lottery. Maybe
lottery. Okay.
A lottery. You know, like okay, so the big guy got it, but the little guy got it too. You know, maybe if you're having a party and, you know, as Latinos, we always bring a little bit more and we'll be invited. And you only have one cake that feeds 50. Well, you're going to cut the cake smaller. And it's going to help us survive. Maybe pay the bills, pay the water, keep a core staff, you know, administrating the program, oversight, and programs also. How about assistance to those who don't know how to navigate through this complex system?
Right.
I know personally, I would have had a heart attack if I had to do it. I had my business partner and one of our employees do it. And I could see it in their face. How's it going? They're like, don't even ask, you know? And I'm like, okay, I'm going to go feed the community and the healthcare workers. And that's what I did. That's how I survived.
Well, thank you. Sí se puede, and I listened, and we'll work on it. So thank you for sharing your thoughts. And I look forward to driving to Arizona and eating at the other restaurant that survived. So thank you.
Thank you. And Mr. Graves also has a question.
Silvana, mucho gusto. Buenas tardes. You talked about the challenge you have facing your restaurant and your employees dealing with COVID. I was wondering if you could help us understand, given the challenge that restaurants have around margins, and how you balance margins in today's world with protecting your employees, making sure that they have a livable, family-sustaining wage. And do you have ideas on what we can do other than the government, or is it just the government?
Well, you know, I am the top leader of my personal government. That's the way I look at it, right? I'm the mayor, the governor, the president of my world. And there's 43 families that sustain their world from this restaurant that we all work at. And the margin has been shrinking, increasing, and rightfully so, wages. You know, when a server, though, I understand, so you don't work in a restaurant, right? So there's front of the house, back of the house. The front of the house comes in, works 4 hours, and gets $500, $6,000, whatever it is, and they're like, oh, they didn't leave a 20% tip. In front of the kitchen, it was just making minimal wages. That is totally wrong. I've always been anti that. But how do you entice somebody to come work and do the kind of quality, blah, blah, blah. It's the game that's already set up. A lot of chefs are looking to reformat that and make it to where everybody maybe pulls the tips. So there's one wage and it's a team effort. There's different ways of doing it. That's my world. That's my problem. Your problem is that there's a pandemic, right? The government's problem is that there's a pandemic and there's no leadership. Well, how do we keep the ship from sinking? That I do not know. I do know that we're going to need extended benefits, unemployment benefits, and I do need, I hate to say this, but we need more PPP. That's the end of that. It has to be administered in a way that's equal for everybody, even if that piece is smaller for everybody.
Thank you so much for your testimony.
Thank you so much for joining us. Next, we will hear from Wande Okanoran Meadows. She is with the United Food and Commercial Workers Union. Thank you for joining us. Can you hear us, Wande? We need you to unmute. All right.
I can. I'm with the Little Ones Learning Center.
My apologies. Thank you. But you can go ahead.
Okay, thank you. I wasn't sure if you wanted to bring somebody else in or not. Okay. Well, thank you for having me. I'm very honored to be here this evening. I'm grateful to share my perspective on how COVID-19 has impacted our high-quality early childhood program. On Thursday, March 12th, we had about 175 children gleefully playing around our center. By the following week, once schools were closed, we had about 8 to 12 children in daily attendance. Those days were rough. We were determined to keep our doors open and provide services to the essential service sector of our community. We were also determined not to furlough any team member who wanted to work. They say that small businesses run America. Well, COVID-19 is impacting providers everywhere, and some are struggling to stay afloat. Some have even closed. Others were ready to open, but were unable to secure proper PPE to secure and run their business. We are a critical support for working parents. There's no question that we are all, as much as we can, must get back to work. The only question is how. We are grateful that our Governor Kemp, saw that the need for frontline workers and other essential personnel needed safe places for their children to attend while they were saving lives. He did not force us to close and indicated our work was essential. However, as thermometers became scarce, the price of a 4-ounce bottle of hand sanitizer skyrocketed and wipes were nowhere in sight. I feared for what was in store the weeks ahead. Even though we had reduced our operational hours, it became more costly just to keep our doors open for the few precious children we had. We were using hospital-grade and commercial solutions to sanitize our outdoor play equipment throughout the day. Those supplies began to run low. I would send out emails to other owners looking for leads on supplies, leads on a spare thermometer, or more parents, as more parents began to enroll their child. There was no centralized way for providers to obtain supplies. I actually sent an email to a life insurance provider to express my frustration. Even though the costs were enormous for the few children we had, my mother, who's the owner of the establishment, always has impressed upon us. We will do for one what we do for many. We did not sacrifice the standards of our care, but we saw the effects on our bottom line. My peers on various platforms looking for thermometers, gloves, sanitizers, lab coats, anything and everything that was in line with CDC recommendations. This was a strange system, to say the least, as if it were a black market waiting on someone to say they had a connection. We were worried friends would be sending me links to best homemade sanitizers. Quality matters. We cannot be content with that, and we cannot be content with making high quality care, especially in the age of COVID, cheap or cost effective. Ultimately, the COVID-19 health crisis has really exposed how unsustainable the financing of our early childhood system actually is, with the burden of providing high quality care placed on the shoulders of providers. Right now, we need PPE, but ultimately for things to change, we need policymakers to recognize the importance of investing in early care and education with a focus on the critical comprehensive services, education, nutrition, and social emotional development that young children need and receive when attending a high quality program.
Thank you. And Congresswoman Lee has a question.
Thank you very much. Thank you. One day, Ms. Meadows, right?
Yes,
thank you so much for your testimony. And listening to you, I'm thinking, gosh, these young people are so fortunate and blessed to have you. And here you are struggling just to make things right and safe for them. You shouldn't have to do that. And we should be providing all of the PPE that you need. And so I'd like for you to just lay out the type of PPE supplies that you would need in order to safely reopen. And also, we know that so many minority families are essential workers, and so they're more likely to depend on child care services. And so how do you see this inequity in your work? And how do you help these families really understand and know that we're there for them so that they can safely go to work, but that their children will be safe too? Your program sounds like it's wonderful, and the children are so lucky to have you.
Thank you so much, Congresswoman. So that was it sounded like a paragraph of a question. So I'll try to remember the answers in order as best as I can. I'm an educator, but my brain is fleeting with my own personal kids. So PPE, simple things, just a thermometer, being able to navigate that, gloves, hand sanitizer. I was on Amazon. For clarity, we opened. We never shut down during this pandemic. We were determined to stay open. Hand sanitizer, we went on online to look for some, and it has skyrocketed to almost $9,000 for a pallet of hand sanitizer. And I had screenshot it and put it on my Facebook page. This is what we're dealing with, you guys. It's wonderful to reopen the government. It's wonderful to reopen the state. Excellent. But unless we have systems in place where we can get the supplies at an affordable cost in a centralized way, the more of us that reopen, we're all struggling trying to get the same supply. Your second question was, so it's just the basic supplies, gloves, wipes to keep everyone safe. We're not doing what's just soap and water. We're using high quality, hospital grade. I go to the EPA.gov website to make sure that what we're using to disinfect every single night is on that link. Our swings, our chain links, everything is disinfected. To your other question about what was the other question about how?
In terms of just minority families, of course, a large percentage work in essential services. They need you desperately because they're going to work. Sometimes they don't have the PPE. And so how do you see these inequities in your work with the children and their parents?
Yeah, that's difficult. Our parents need us. We need the parents. It's a mutual relationship. We're happy to be of service to the community. And unfortunately, we know that when we're looking at those comorbidity rates and we're seeing who's ending up at the hospital, I can't help but wonder if part of that is because we are the frontline workers. We are exposed more and interacting with the public more than other populations. We don't have the luxury of working from home. So it's incumbent upon us to make sure that our children are taken care of. So when you're talking about the inequities, we talk about it. Because there's no cure, we are in our garden eating of the land, eating from Mother Earth. We are making and concocting our own cure daily right here in Atlanta. trying to build up our immune systems. We're not going to wait and try to figure this out and wait for somebody to save us. That's what we're doing just daily, to try to figure this out to protect us the best way that we can.
Thank you very much. Your testimony is so valuable and important. We really appreciate your being here. Thank you.
Thank you for your interest.
Thank you.
Thank you so much for representing Atlanta so well. It's a pleasure to see you.
Thank you, Mayor.
All right, please join me in welcoming Peter Rickman with the Milwaukee Area Service and Hospitality Workers Organization.
My name is Peter Rickman, and I'm the president of the Milwaukee Area Service and Hospitality Workers Union. On behalf of our members, let me welcome you virtually to our
And then we'll come back to Mr. Rickman. Thank you.
Can I get started?
Yes, please.
Okay. Thank you for inviting me to discuss the impacts of COVID-19 on frontline transportation workers and the need to ensure frontline workers are made whole for their sacrifices during this time. My name is Tyler Shaw, and I'm a bus captain in Philadelphia and a member of Transport Workers Union Local 234. I've been a driver for 20 years. Previously, I served 10 years in the United States Army, driving heavy equipment through war zones. My military service ended when I was critically injured while serving in Iraq. After 18 months of surgery and rehab, I returned to SEPTA in 2007. I'm proud that I've been able to continue serving my community at home just as I did overseas. Throughout the pandemic, my priority has been protecting my wife and 4 children. Last year, my 8-year-old was hospitalized due to a respiratory infection. His condition puts him at an elevated risk for COVID-19, and I'm terrified that my job puts him in greater danger. My biggest fear is I will pass it along to him or be forced to quarantine for my family. Before the pandemic, the first thing I did when I got home from work was hug my kids. Now I throw all my clothes in the wash. I take my own temperature because I'm the primary income earner for my household. I have to keep working to provide for my family. But I'm constantly worrying about the danger that my work poses to our daily lives. At the same time, I feel a sense of duty to my community to keep our transit system running. Each night on my bus, I drive nurses and other essential workers to and from their jobs. They rely on the service that I provide to help get through the pandemic. Unlike others, we do not have the luxury of working from home. At the beginning of the crisis, I bought my own protective equipment, including masks, gloves, sanitizer, and disinfectant. My coworkers and I even learned to make handmade face coverings. My union eventually stepped in to provide these essential items when our employees would not. These ongoing problems have resulted in a high infection rate for transport workers nationwide. 133 TW members have died, and there have been more than 3,000 confirmed cases. To date, nearly 10% of TW members have died, tested positive, or been quarantined due to COVID-19. Our work is hazardous. Other workers who knowingly walk into danger are compensated with higher wages, education, healthcare support, and other federally funded programs. There is no question that the transit and other essential workers deserve these protections. I urge the committee to include strong language in the Democratic platform promising hazard pay and the full slate of these programs to all essential workers. Thank you, and I look forward to answering any questions.
Thank you so much. Our first question is from Dr. Allen.
Thank you, Madam Chair. Good evening, Mr. Shaw. Thank you for your very candid and important testimony. And more importantly, thank you for your service here and abroad on behalf of your country. We very much appreciate that. Could you talk a little bit more about the importance of hazard pay and paid leave for you and your family, as well as your brothers and sisters in the union? I just want to make sure that we get that all on the record.
Thank you for your question, Dr. Allen. There is no question that essential workers are facing hazards that we've never faced before. We've been asked to go to work and face more risks at a time our government told everyone else to stay home because it was too dangerous. Paid FMLA is extremely important, and no one should have to choose between their family or paying their mortgage. Paid leave helps cover the cost of PPE as well as hazard pay.
Thank you, sir. Appreciate you.
Thank you, Congresswoman Holland.
Thank you so much, Mr. Shaw. Thank you for your service to our country and the military. Thank you for your service to our country now during this pandemic. And every single coworker and person that is serving with you, just know that we all appreciate your service to our country. Thank you for that testimony as well. Thank you very much. So this pandemic laid bare the disparities countrywide in many areas, but absolutely with frontline workers like those you represent here today. In this age of COVID and looking beyond this current situation, how do we make your job safer? I know you mentioned a few things, but can you expand on anything or just tell us what we have to do to make sure that transportation workers are protected and are safe?
Thank you for the question, Congressman Holland. PPE is the biggest thing. We need masks to slow the transmission of the COVID-19, as well as investing in mass transit infrastructure to provide more service and avoid overcrowding during rush hour, passing people up. Unfortunately, every day when I work, I end up passing people up because I'm at capacity and I cannot put any more people and put myself and other passengers at a greater risk. So again, PPE for masks for everybody and investment in our transit infrastructure to allow for more service.
Thank you.
Thank you,
Madam Chair.
Thank you, and all the best to you and your family. I have 4 children with asthma, so I know this is an especially scary time for kids with respiratory issues. So I hope your child is doing much better. Thank you.
Thank you very much.
Next, we will hear from Chris Brown. Chris is a nursing home worker and a member of the Service Employees International Union. And I'm making sure I think we have a bit of a change in the lineup here. All right. Linda Edam is going to come up next. She is the Senior Advisor of Global Policy and Advocacy at the Bill and Melinda Gates Foundation. Thank you for joining us.
Sorry, thank you for having me. Can you hear me all right? All right. I'm really honored to speak to all of you today. And I know that one of the things that you've been hearing all day has been how terrible the impacts of COVID-19 have been. My goal today is to just sort of give you a brief overview of some of the global impacts that we're seeing. Before working at the Bill and Melinda Gates Foundation, I was over at USAID as Assistant Administrator for Africa. And there are a lot of crises. And what we're seeing right now is that COVID is just deepening all of those existing crises. In less than 6 months, I think we've already established COVID-19 as the pandemic of our generation in terms of the humanitarian impacts that we're seeing across the world. There are already 500,000 additional people who have sunken into famine conditions. And what we're worried about right now is that already this morning we had 500,000 recorded deaths around the world. We think that there will be 36 famine declarations by the end of this year if humanitarian aid workers aren't able to get learning domestically. And so I have 3 quick points on what the lessons learned are and 3 quick recommendations for solutions. First, leadership matters. Who's at the top of the country, what decisions and choices they're making matters. What also matters is the fact that the United States has been absent from the leadership table around the world. And so at a time when we need to step up and help coordinate international responses, set up global standards for allowing humanitarian access into various areas, we don't actually see that taking place. Next, that exacerbate existing inequalities. So just as minority communities in this country, people who are already poor in this country are sinking further into poverty or further at risk, we're seeing those who are already vulnerable becoming increasingly vulnerable. So if you were somewhat hungry before, you may be on the brink of starvation. We already have 500 million people who will be facing acute malnutrition by the end of the year. And last, health systems are overstretched. And in a country like ours, where we actually have the health capacity to do more, when we think about what's happening in developing countries that don't actually already have that health capacity, the impacts are devastating. So what needs to be done? Well, first, a next administration should rejoin organizations like the WHO and really lead on the global response. Right now, we should be really looking at how we can lean into joining the rest of the world and figuring out how to distribute and come up with a vaccine. WHO has a vaccine accelerator, so do a number of private foundations. The US should play a role. Next, we need to actually make sure that the work of USAID and our development institutions and organizations are focusing on these marginalized communities. And last, it's going to be really important that we make sure that we look at health system strengthening opportunities across the world, not only single disease responses. So the pandemic has wraparound effects. So we need to make sure that we have a holistic response and that we have a pro-poor inclusionary economic policy. I know my time is up, so I wanted to make sure that I left time for your questions.
Thank you very much. Ms. Smith has our first question.
Thank you, Mayor, and thank you, Linda, for your time today and for your very thoughtful remarks. We really appreciate all the work you're doing, and I agree with everything you said. You mentioned that the U.S. and the Trump administration is abdicating kind of its traditional leadership role in the world, and you mentioned a couple of ideas on how the U.S. could reestablish itself, namely by rejoining the WHO and returning to that organization. Do you see other ways in which the U.S. could reestablish itself and become the global leader around the pandemic? Do you see opportunities in other institutions, whether it's the G20, the G7, the United Nations, maybe it's all of the above? But what would other priorities look like for you for a new president coming in, interested in returning to the global stage and offering better leadership?
Yeah, the United States really has a credibility issue right now, and what we need to do is rejoin the world. So all of the institutions that you mentioned, we need to insert sort of greater leadership and show that we are dedicated to helping to lead a response. And so that's at WHO, but that's also, as you said, within the G7, G20, really working with private institutions, look at CEPI. The vaccine response is going to be probably the most important challenge on the global stage that we're all going to be facing. WTO, making sure that we're actually paying attention to what sort of restrictions and standards we have across the world. The U.S. is not playing the leadership role that it traditionally does. So that's one thing. Next, it's going to be really important that we also have a longer term view and plan. And so what we tend to do is react to crises, but we know that if we get through COVID-19, we don't want to be in this situation again on the global stage. So making sure that we're setting up a global architecture that's fit for purpose. So making sure that there is an organization that is prepared to evaluate the work that the WHO is doing, and that we're leaning into health system strengthening around the world is going to be very important. Next, we lost a lot of credibility domestically. CDC used to be the gold standard around the world to look at for infectious disease reporting on pandemics. People trusted CDC in a lot of places before they trusted WHO. We need to restore its credibility, make it very clear that this is a science-based institution and develop policies that won't block them from being able to report on information and strengthen it so it's fit for purpose in the future as well. And then last, I think, most importantly, is that we need to be saying the right things and denouncing the rise of authoritarianism and the dictators that we're seeing across the world that are using this pandemic as an excuse to do bad things to the people. This is lessening credibility and sort of fanning the flames of misinformation around the pandemic, which makes it really harder for public health officials and humanitarians around the world to actually contain this crisis.
Thank you. Our next question is from Mr. Orton.
Hi, thanks for joining us and for your testimony and for your work. I wanted to broaden it out just a little bit to discuss how Trump is disengaged internationally on the health front and other fronts. We discussed he's pulled out of the WHO, he cut international money for CDC programs, the list goes on. And, it seems like scaling up the military budget and the Pentagon seems to be the only avenue of international relations that he's familiar with or likes. Can you talk a little bit about how that imbalance has affected our reputation as a country, and some specific, any other specifics on how we fix that dynamic, not just in terms of rejoining programs, but specific opportunities to lead. And then I want to ask, when a vaccine is discovered, what should happen in terms of how it's shared internationally, what it costs? What should happen on an international stage with an eventual COVID vaccine?
That is the harder question. So I'll start with the first one, which is very easy as well. So yes, I mean the imbalance of spending between military and civilian organizations is astounding, and that clearly is something that would, right sizing that balance would help, especially since the way that we need to respond to the second order effects of this pandemic are going to have to be more comprehensive, resilience-based, and focused on fragile states. And we know that the best investments are, development, preventative work before you actually have to do intervention. So that balance. But I will also say that I did spend some time as a civilian in the Department of Defense for a while. I have family members who are also in the military right now, and I would say there's also a misalignment of the spending within DoD right now. He's also cut spending on health programs within DoD. And so ways that we sort of depend on Department of Defense to sort of monitor pandemic threats across the world, those efforts have been cut as well, and there's invest. So it's both making sure civilian agencies have the resources and funding they need to actually respond to the real threats that we're going to start to see and stop fighting only 9/11. But making sure also that the resources that we are dedicating to the military are also fit for purpose for this new environment that we're living in, because they also have a role to play in some of this. As far as your second question about what should we do when a vaccine... I think, this is why you have multilateral institutions, right? You want to make sure that you have U.S. interests at play, that we understand, like, collectively all the information and data available, and that we have a plan to make sure that we're reaching the most vulnerable in the places that make the most sense, so that we're actually curbing the pandemic worldwide and not just doing these stopgap measures that won't allow the world to reopen. And so it's going to be hard for any one country to make its own plan and think that we've solved this. And so what's going to be really important is for a group of countries to get together. But, a distribution plan, making sure that we have agreements on supply chain, making sure that we have our equity principles very clear up front, that we're at the negotiating table now, and that we're not just playing catch up at the end and setting up a world where vaccine will go to the highest bidder. It's not in anybody's interest.
Thanks so much.
Thank you so very much. We appreciate your testimony. And we are going to go back and see if we can get Mr. Rickman pulled up.
My name is Peter Rickman, and I'm the president of the Milwaukee Area Service and Hospitality Workers Union. On behalf of our members, let me welcome you virtually to our city, just the same as we would have to the Fiserv Forum, where our union recently won a standard-setting contract transforming the lives of over 1,000 people. You know, once upon a time, Milwaukee is the best place in America for Black folks to raise a family, when our city had tens of thousands of living wage union jobs in the factories and foundries across the north side of town. Now, we're considered the worst. Those factory jobs are gone, and they're not coming back. They've been replaced by low-wage service sector employment that drives up poverty, drives down living standards for all of us. But, you know, those industrial jobs weren't always good family-supporting, living-wage union jobs with health care and pension. It took a workers' movement in the streets and politicians advancing a bold, aggressive policy agenda to balance the power between bosses and workers so that working people could transform the low-wage, dirty, and dangerous jobs of the time into the back of the first middle class. It wasn't perfect, in fact, far from it, but we started to make real progress on addressing the original sins of America in racial inequality and injustice. We started to transform a Gilded Age economy built for the 1% into something that more broadly shared prosperity that working people create. That's the model for how we can transform the jobs of today and tomorrow. The CNAs and the cooks, the janitors and the housekeepers, the security guards and the customer service reps, the service sector jobs that disproportionately employ people of color, the service sector jobs that disproportionately characterize most employment growth today. We can transform them into family-supporting, living-wage union jobs. We've got a model right here in this arena district. All the employers are on a $15 an hour minimum wage, and workers can come together to organize a union and bargain a contract. And in fact, we've done just that. We can make Milwaukee a place that values Black lives, that dignifies all labor, and that builds an economy that works for all of us again, if we build on this model. And we can do that for all the Milwaukees of this country if we make it our federal policy. So we need some help. We need your help. First, we need political leaders to balance the bargaining power between bosses and workers by writing a new labor law for the 21st century, not tinkering with an old labor law that was written closer to the Civil War than it was to today. First, in the service sector, which produces the jobs driving a low-wage economy, we need to balance the power across all employers and workplaces in an industry, not go banana stand by banana stand. We need a bold, aggressive labor policy that builds a table with all the employers and puts workers at it with equal power. The wage standards and essential rights across the whole sector. Second, the vast majority of service workers will never get health care coverage through private insurance by their employer. We need to join the rest of the industrialized world and provide health care by right with a public health care program like Medicare for All. Now, this is an opportunity here to write a platform that inspires the working class of this country to make a choice in November. And it's a chance to write a platform that produces a blueprint for a Biden administration that transforms this economy and transforms this country. We're calling on you, the working class service sector workers of America are calling on you. We need your help, and we're ready to fight for it. So thank you for your time and your attention. Solidarity.
All right, that's great energy for this evening. Now we'll hear from Chris Brown. Chris is a nursing home worker and a member of the Service Employees International Union.
Good evening, and thank you to the committee for allowing me to share my story today. My name is Chris Brown, and I'm a nursing home worker for Chicago. Although the work is rewarding, I, along with other nursing home workers, face many challenges. These challenges, like short staffing, existed before COVID-19. So it's no surprise it's hard to recruit new workers when wages are so low. Low wages continue to plague the nursing home industry. It's a big reason why employers cannot find work. I work on the floor where residents are bedbound. It takes a lot of physical labor to take care of these residents. We move them to make sure they don't get bed sores. We change their linens and their stored garments. Short staffing means less help and less time with residents. Short staffing also means we come into contact with more residents. When workers come into contact with more residents, our risk for exposure to COVID-19 becomes heightened. We don't know if the residents are tested when they arrive, if the residents are only tested when they show symptoms, but by then it's too late. If I become sick, how can I take care of somebody else? Who would take care of me if I become sick? Not having enough PPE or the right PPE compounds don't see as risk. I have more direct contact with residents than medical staff at the nursing home where I work, and I'm given a single-use mask. Some workers put their masks in bags just a way to ration them. When the pandemic hit, we did not know there was no policies in place to tell us whether we were working with infected residents or not. In my facility, we had to wait 4 weeks between cases of COVID-19 appearing before it became confirmed. We never knew whether I came in contact with the patient, and I was scared, and also my family was scared. Eventually, I had to move out of my house because my family was afraid of being sick, and I was afraid of getting them sick. I haven't seen them since. I continue to hope and pray for this change for the better. I'm lucky I'm part of a union. By coming together with other workers, I was able to demand better wages and benefits like paid sick time, but it's just a start on what workers really need. This is why we need to make sure working people are a part of the conversations about how to fix long-term care systems moving forward, and I hope that we can send more people back to work like in Joe Biden's plan. I am not alone, and there are stories happening like this everywhere. I hope that we can improve healthcare and make sure workers like me have a voice on the job and that all people are protected. Thank you.
All right, that's great testimony. Court Wayberg is up next. Court is the Executive Director of the Mayor's Commission on People with Disabilities in the City of Philadelphia.
Good evening, everyone. My name is Court Wayberg, and I'm the Executive Director of the Mayor's Commission on People with Disabilities in Philadelphia, and I'm a member of the Disability Council of the DNC. And we're talking about COVID-19 tonight. And there's 3 priority areas that we want to make sure are addressed when we're talking about the serious disease. That's healthcare, education, and voting. And now with healthcare, we've seen that over 40% of people who have died of COVID live in nursing homes. And that's a real serious issue since people with disabilities are still largely institutionalized. So one thing we really need more of is funding for home and community-based services, or HCBS, so that people can be in their homes and safer from catching and ultimately dying from COVID-19. Another issue we're seeing is healthcare rationing. So people deciding that those with disabilities, their lives are less or worth less, and deciding whether they should get ventilators or other medical equipment. We've seen this in various states, and that just has to stop. We value people with disabilities along with everyone else as deserving of healthcare. It's not a privilege, that's a right. And moving on to, and regarding the Affordable Care Act, we've seen the Trump administration continue to try to whittle away at its protections. But if it is ultimately not kept, over 20 million people will lose their coverage, and many of them have pre-existing conditions. So that's a lot of people with disabilities losing the health they come to rely on for several years. We hope to expand upon the Affordable Care Act during the Biden administration. Moving to education, during COVID, we've seen a lot of equity issues as far as digital access to special education for people with students with disabilities. We've seen a lot of people of color, refugees, immigrants, people who are homeless, have a lot less ability to have internet access and computer access, therefore making it hard for them to learn, and that has having a huge impact and creating huge disparities between those of privilege and those with disabilities and other marginalized groups. So we plan, we would like to see additional funding go not just toward special education, but toward the actual infrastructure to enable students with disabilities to have equitable access to education services. Finally, in voting, we have seen already how COVID has had a huge impact on people's ability to vote, especially in the Wisconsin primary. So we support universal voting by mail including access to software so that people with disabilities can vote in a secure online setting as well as by mail. We also support curbside voting, as well as the ability for people with disabilities to have someone with them if they choose to assist them in voting. And that person could assist them, whether it's curbside, whether it's filling out a mail ballot, or helping them with their technology. But it's important that people with disabilities make that decision on their own. We also support greater enforcement of the Help America Vote Act and additional funding for states so that they can make these changes happen, so that millions of people with disabilities are not disenfranchised during this election. Those are our policy positions, and I'm happy to take questions at this time.
Mr. Wayberg was actually joining us with video testimony, so if there are any questions from anyone joining us today, you can send that via email. We will make sure that we provide answers for you. And next we have Anna Flemings. Anna works at the Maximus Call Center and is a member of the Communication Workers for America Union.
Good afternoon. My name is Anna Flemings, and I am here today to give my testimony to the Democratic National Committee. Again, my name is Anna Flemings, and I am a single mother who works full-time as a Tier 2 customer service representative professional at Maximus in Hattiesburg, Mississippi. My job there is to help the American citizens with questions about affordable health care and Medicare plans. It's a job that I extremely am proud of, but which I only make $12.11 an hour, far below what the federal minimum wage should be, making for kind of technical work that I do. I am proud to be a member of the Call Center Workers United National Organizing Committee and have been building a union for the pay and respect that we deserve, my coworkers and myself, for what we do for several years. Again, I am so happy that I was invited to speak to you today. I also had the privilege of meeting some of the Democratic candidates earlier in 2019. What a privilege. And just to let you know and to give you information, first I would like to say thank you so much for taking the time to allow me to speak on behalf for the Democratic National Convention Committee have a conversation with you and an opportunity to speak with you on behalf of myself and my coworkers. Now, many changes have been made, but recently, due to the COVID pandemic, has really shown why we really need a union and a real voice at work. We work at a call center, Maximus, implemented emergency policy leave after we came together and put in a lot of pressure on them publicly. But many of these policies were inadequate, delayed, and often afforded to not at least 8 of the 11 call centers were temporarily closed down due to someone being exposed with the COVID-19. Now, with this being said, some sites were only closed down for a time limit of 48 hours, some for a minimum of 24. This was to be able to supposedly clean and sanitize. As you know, and I know, there's no way that this could be done. And even though right now, due to the things that have been made, we have been able to work from home. So that's one thing that we push for, is trying to unionize and to get some help. Again, with some of us that are there, we had to actually go in and spend additional money that we do not have in order to get equipment so that we would be able to work from home. Mind you, $12.11, and we are already struggling, is hard to do. You make sacrifices because you like your job. Now, I would like to say to each and every one that's at the Democratic National Convention and Committee people, we are standing together, being united, trying to get a union so that with this union, issues that are before us now, like this pandemic, would already have been better prepared to help us. As you can see on today, I am wearing my United Organizing shirt. Me and my co-workers are determined to always push forward to get a union so that we can unionize. So when it comes to November, please remember, us essential workers, when it's time for the election, again, we would love to be unionized, and we would definitely love your support because we do work for federal contracts from the federal government. Thank you again. My name is Anna Flemings, and I work for Maximus from Hattiesburg, Mississippi. United, united, united.
All right, that was great testimony, and with all of those who offered a testimony via a video, please forward your questions via email. We'll make sure we get responses to you. And Ms. Fleming concluded our testimony for the day, so we have reached the end of our hearing. On behalf of the Drafting Committee, thank you to everyone who joined us today to share your perspectives and recommendations on how to best address the issues facing our country. We appreciate your engagement today and look forward to working with you as we work to ensure the platform that we create reflects our shared and collective values and is a tool to elect Joe Biden president. Please join us again on Wednesday, July 1st at 5 p.m. Eastern Time for our next hearing, where we will be focusing on the vision for a more equitable future. You can also go to stories.demconvention.com to share your thoughts and your ideas. Thank you, everyone, and I hope that you all have a great evening.